hospitals. So again, just keeping everybody up to date with our EOC meeting on Thursday, as well as our fire and EMS meetings, keeping our volunteer fire and EMS agencies in the loop and trying to keep up with the changes that are coming through the Bureau of EMS and PPE. So I don't know if Patrice is on yet.
Yeah, I am.
Yep.
I couldn't
Go
get
ahead, Patrice.
unmuted. Okay, I couldn't get unmuted, so I apologize. Are you finished, Tom? I'm sorry.
Yeah, yep. That was just kind of the supply side of it. So.
Hey, Tom,
Okay.
Dave Baker. I talked to some providers over the weekend from hospitals and long-term care facilities, and it seems like they have the protective garb, and I don't know if this is the new normal, but it used to be considered disposable. Now they're reusing things and getting longer life out of their N95s. And do you see that as part of a shortage, or do you see it as the new normal?
They're following the guidance of the Iowa Department of Public Health on what they can use as far as reusing if it's not dirty and such. And I think it's just still that we are, even though we're sitting a little better here, we're still in that shortage nationwide. So.
Okay, my question was going to be, do you see this as, obviously there was a shortage, and hopefully at some point we'll be able to, restock and make sure there's plenty, but do you see any of this as the new normal, or are they, simply getting by with what they have, and this isn't necessarily a best practice?
No, I think it'll go back to normal once, as they get baking more and start using less as we get on the bottom side of the curve. I would hope that, and then I hope I think there'll be a different thing. Everything was just in time ordering as far as, and then people weren't stocking up very much on the PPE, especially these isolation gowns that cost probably less than $1 on a normal basis. I think you're going to see a lot of changes that way, where, some of these corporate long-term care facilities or hospitals might be, having more stock on hand, But I think it'll catch up once we start using less as we get hopefully on the downside of the cases here.
And do you think do you think that's something that we might look at different nooks and crannies to try to stock up from the emergency management side as well?
I think so, because some of the grants we're seeing that come through, like the commission gets the $39,000 federal emergency management performance grant. They're already talking about a supplemental coming down for that, and one of the things you can use it for is restocking PPE supplies. So I think that's some questions I received from some of the other elected officials too, and I think we'll definitely look at that. In fact, we did put up a couple shelving units out here in the arena, because we know we're going to have some leftover items, and it's stuff that might have a shelf life on it, but as we've seen with this emergency, we're still using stuff from after the H1N1, and they come out when you're short supply. Then the expiration codes don't mean as much. It's better having the protection than not. So.
Okay, thank you, Tom.
That makes sense anyway.
Ann McDonough, I have a question for you, if I might. This isn't about PPE. This is about supplies for any type of, I think we have at least one in the city of Dubuque, an isolation area, a quarantine space. And on social media, there's a request for forks and knives, for dishes. Is that our facility, and is that how we're stocking and supplying that location?
I'm not real sure, and that's done through the city with their So I'm not sure if I'd have to look at social media. I don't trust that very much because there's a lot of rumors out there, you know, and the people working on the city side have not requested anything other than some PPE for the site. So I don't know about the forks and knives and such.
But wouldn't we be responsible for bringing in supplies for that, so it's covered by the FEMA grant?
And the people that are running it know how to get them kind of supplies. So I don't know if that's something they're working on. I'd have to follow up on it.
Could you do that? I'd like
Yep.
to see that we're not, you know, begging for folks to give us their hand-me-down dinnerware. That's great if we have a repurpose for it, but I think we want to make sure that those conversations about isolation areas are kept at the emergency management level.
Yep. I will follow up with the people that are in charge of that.
And I'll send you a private message as to the name of the person posting.
Thank you.
Thank you.
Sounds good.
Okay, any other questions for Tom Berger? That will throw it over to Patrice Lambert.
Okay. Good morning, everyone. I just want to, good morning, to inform everyone that Tom is going to stay on the line, Tom Berger, and I know Stacy Killian with the VNA is also on this call. So if I forget to share something, please jump in. But I think I have everything pretty much planned to share everything. I can tell you an update as far as our testing capability for Dubuque County. I was in multiple conversations with the governor's office and the Iowa Department of Public Health last week. Dr. Bobby Canero, who is our medical liaison with the healthcare providers, had pretty much given us the directive to look at testing in twofold. One, with the Test Iowa population, and that would be basically requesting the Test Iowa site to come to Dubuque County. And if that were not a possibility, to see if we could test those individuals living in Dubuque County who have completed the Test Iowa survey online. They're eligible, but they were not able to travel to one of the site locations due to transportation or their schedule or whatever the case was. And then our second priority group would be testing our contact tracing population. So on late Friday afternoon, the Incident Command team members, Tom and Stacy, Mary Rose has had a conflict, but she'll be joining us tomorrow with all of this. But we did have a conversation with IDPH and the governor's office again. And unfortunately, we were denied the request to have a Test Iowa site, and we were denied to test those individuals who were eligible through the Test Iowa survey online program. The state of Iowa was unable to grant those requests at this time. We did inform them that we, as well as local officials, will continue to request and to pursue the community testing for Dubuque County. But I just want everyone to know that that was one of the two priorities that Dr. Bobby Canero was requesting, and that was denied. But our second request with the contact tracing population, we did get the approval. And we also had requested for testing not only with our contact tracing population, but with our long-term care and assisted living staff in Dubuque County. Both of those were approved Friday afternoon, late Friday afternoon. So we have been working on those two requests the whole entire weekend. And this is what we have to share with you. So we have been given the approval under the direction of the IDPH to conduct targeted COVID-19 testing this week for long-term care facilities and individuals that have been identified through contact tracing as having possible exposure to positive COVID-19 patients in Dubuque County. the targeted testing plan for this week is not going to be open to the public. And this is not a community testing program. And again, we're not able to relate it to those people who have been eligible for the Test Iowa program. We are looking at approximately 1,000 Dubuque County residents to be tested through this targeted testing program. And the testing will begin on Wednesday. We will do the testing Wednesday, Thursday, and Friday at several locations throughout Dubuque County. We are looking at, with the targeted testing, we are looking at staff, possibly from the long-term care facilities, and then the residents who have been identified again through that contact tracing. We are hesitant to publicly announce our locations because the people who are in the process, we have started to notify, but they will be, we'll continue to notify the people today as well. We have given them some special information that they have to bring to these sites, as well as their identification. We know that we would love to open it up to all residents of the county, but at this time, we are not able to do that. We are only able to target on the two populations that I had said, the long-term care and assisted living staff, and then those individuals that have been identified through the contact tracing as having possible exposure to positive COVID-19 patients in Dubuque County. So it's going to be a very aggressive testing 3 days. We will only be doing the nasal swabs, no serology for these patients. But we had thought this is a window open for us. We are going to do this. We are going to continue to request to get Test Iowa into Dubuque County. The Iowa Department of Public Health will pick up the cost for the collection kits as well as the lab cost. However, the county will be responsible for the staff and the location and the security for opening up these sites for the 3 days. But again, we just felt with this opportunity, it's not the full request that we had asked for. But if we can target on these 1,000 Dubuque County residents through the long-term and assisted living staff and then through the contact tracing people, at least we are doing something. So that's pretty much where we're at right now. We still have a lot of planning going on. We worked the whole entire weekend to fine-tune many of the details. Any questions? I mean, I know that it's not what we had asked for, but we're happy that we are looking at our contact and long-term care staff members. So any questions with that at all?
Patrice, this is Diane Pate-Freiberger. With these 1,000 collection kits that'll be coming from the state, are those able to be split like the ones that UCL has done? You know, they started out with a smaller number, but they were able to have the availability to split those. That's one thing. And two questions. And another question is, you had said several locations. Is that two, or do you know a number on that?
We're working, I can answer the second question easier. We are working with our long-term care facilities and assisted living. We're hoping to have some of that testing done on site. So that's why we're not able to, one of the reasons I can't tell you the number of sites that we will be testing on. And then with the collection kits, they are coming through LabCorp, and that's all done through IDPH. So they're going to be sending us the barcodes, the sheets that have to be completed and sent back. The courier from LabCorp will be here every day, Wednesday, Thursday, and Friday, to collect all of the samples that are done that day. So no, we are not able to divide those collection kits. They're going to be specific.
Patrice, when will we get those results back?
With the LabCorp group, they're hoping that it's going to be very, very soon, like within the 48 to 72 hours. But we can't promise anything at all because we don't know if, we do know with the Test Iowa that all of those results do go back to the hygienic lab. So we don't know with the LabCorp what their backlog is, but we truly are hoping within 72 hours we should start getting those results back, if not sooner. But we can't promise that.
Have you been told a time frame, or are you speculating?
Speculating from the long-term care initiative that when was our discussion with that? My days are all blended in. I'm sorry. But with the Iowa Department of Public Health, when they had explained the new initiative to Stacy and I believe it was I don't even know when it was, last Tuesday night or whatever, they had said with LabCorp that they are not as backlogged as the hygienic lab was, and that they were looking at having results through LabCorp be returned 48 to 72 hours. But again, that's just speculation. They have not given us for this group a specific time frame.
Patrice, this is Diane Pate-Freiberger again. I understand that 1,000 collection kits are going to be coming and that they can't be split. Now, with that new initiative, that was also if there is one positive case within a long-term care facility, that long-term care facility could request the state to send them collection kits for all of their residents and all of their staff. Now, in addition to that 1,000, if we have a new long-term care facility that comes up with one positive case, can they still request to get those test kits from the state?
Yeah, and that's the initiative through the Iowa Department of Public Health, so we don't have anything to do with that program. But what their new initiative is you're absolutely correct. They said that they were going to be starting to contact those long-term agency or long-term care facilities that have an outbreak, as well as 1+ identified case in a long-term care facility. And then they would expand it out to the other 400 long-term care facilities in the state. But this program has no correlation with that program. This is a complete standalone program for Dubuque County for this week.
Thank you. I have one other question, and it had
Sure.
been brought up by Supervisor McDonough earlier in this conversation regarding supplies for the isolation houses. I had seen that post on social media, so I know that it was there and it was by a reputable person. But my question is, have we set up, how many isolation houses have been set up? Do we have preparation for more, in case we need more? If one fills up or a population fills one up, do we have other isolation places available?
I know that the city of Dubuque is working on that, but no, I cannot answer your question at this time. I know, as Tom had said, we will be glad to follow up on that. But we, like Tom had said, if any requests come as far as any supplies at all, they would go through him. But at this time, Diane, no, I cannot answer that question. But we can follow up and let you know.
Patrice, Ann McDonough speaking. I think that Diane's questions about numbers and capacity for isolation and / quarantine, that's critical information. And I am going to ask that you contact me privately if you have that answer. But also on Wednesday, I would like to have this be a topic for us to be discussing inside your report, specifically an update on isolation and quarantine preparation for numbers. We're getting 1,000 test kits, doing contact tracing. I would expect that our numbers of positive tests and possibilities of offering isolation will be greatly enhanced over the next week. And I think I'd like to know what that looks like and how prepared we are.
Sure. And Ann, I will have to be honest. I doubt that either Tom or I are going to be available on Wednesday, but we can either get someone to report that information for us, or else we will get some type of a written report for you. Because
Of course,
Tom and
we can move the meeting time to any time that you are available.
And I can't promise anything. We have been working all weekend on this, and this is our priority. And I think our time is going to be completely focused on this, Ann. But if we can't be there, if we can, we will personally share the information. But if we can't, we will have someone present or a written report for you.
With
And
regard
if we
to
can be there, we will be there, Ann.
right, and you understand that my questions are specific
Absolutely.
to isolation quarantine, correct?
Correct.
That I'm not looking for a general report. Yes, we'd like a general report, but this is a specific item of whether or not we're prepared for this.
Correct.
Supervisor McDonough?
Uh-huh.
Supervisor McDonough, this is Ed Raver. Thank you, Patrice, for that report. I would like to see if later today we can schedule some of the participants, some of the parties working on that at the City of Dubuque, securing some location or a location so far and working on multiple, if they could be available for a work session on Wednesday morning during our meeting. I think that would be something that hopefully we can arrange as well as some sort of report back to you. I think that's a great idea.
I don't
Patrice,
know if
this
I
is
can
Diane
jump
Hakel.
in yet or not. This is Susie. That contact tracing that you're talking about, is that contact tracing only associated with the long-term care facilities?
No,
or is it
nope.
with anybody
It's for all
that's
of
tested?
It's for all of our positive. And the communicable disease nurses and Stacy have been working on that.
Okay, good.
Yep.
Thank you.
Uh-huh.
Patrice, this is Diane Pate Freiberger. One of the long-term care facilities had a mass. All of the employees, all the residents had that testing last week. And when I look at the dashboard, I'm still seeing them at the same number. So it's my assumption that those reports have not come back yet. So provided that those come back, those residents, they stay there. They don't have family coming in and out, but those employees go out to their families. So does that mean that those employees, whoever they contacted, could also be tested?
All of their employees were just tested this week. So those results, again, all of those went down to the hygienic lab. So those they had told us were backlogged. So actually those results should be coming back this week. So that group will not be participating in this because we haven't even gotten their test back from last week, all of those as of yet.
So I just want to make sure I understand. It was my understanding that they were going to be tested last Thursday. And sometimes with staffing, you can't always have all employees there in one day or 2 days. But you said this week, and I know that we've all lost track of time. But does that mean that they weren't tested between Thursday and Friday and that they were tested today?
No, it was our understanding that those collection tests went down to the hygienic lab. And the hygienic lab had told us that their backlog was at least 5 days, if not longer.
Okay, so if they were sent Thursday, Friday, we should be seeing those back soon.
Correct, this week. Correct.
Thank you. Thank you very much.
Sure.
Patrice, I got one more question. I got a call from a friend that, actually a call from two different friends, that the long-term care facility that their parents were staying at had a positive. So one positive, technically we should be testing all of those residents and staff. Are we doing that?
That is now through the new initiative of IDPH. So I have not heard of that nursing or that long-term care facility. Stacy, are you on? Stacy Killian, can you unmute Stacy?
Yeah, because I heard it from two different
Okay.
sources at the same spot that somebody,
Yeah,
they
and
were
I
called
have not.
from the facility.
I have not been notified of that. But if Stacy,
Can you
is
hear
Stacy
me?
on?
Oh,
Yes,
yep,
now we
can hear you, Stacy.
Okay.
Stacy,
So
can you answer that?
Sure. Our understanding with Iowa Department of Public Health is they've been in pretty good contact. That was starting last week with every facility. This is a new one. I have posed a question to IDPH to make sure that they had been in touch, and I have not gotten a response back. But judging from history and how quickly they've responded when it comes to long-term care, my assumption would be that they've already been in contact with them, and that does fall into that initiative. Whenever there is at least one positive, then yes, everybody would get tested, staff and residents both.
Can we make sure that's happening?
Mm-hmm.
Yes.
Okay. I
And
appreciate that.
Thank you, Susie, for that question, because I also heard from guardians of individuals in a long-term care facility there. Okay, Patrice, when the question was asked, you had not heard about it. Stacy had heard about it. Who is responsible for follow-up, and when is that follow-up, going to happen?
Are you asking about the long-term care, Diane?
Yes. Who's responsible for follow-up to make sure that contact has been, you made that contact inquiring, but from my understanding with that initiative, it's actually the long-term care facility that's supposed to be requesting that.
Correct. And Iowa Department of Public Health should be doing the contacting. The request that I had made was just to ensure that it was being followed through. It's just, but Iowa Department of Public Health would technically be the one letting them know, and they should be reporting it out through, they have a system, all the long-term care facilities do, with Iowa Department of Public Health set up to do monitoring, and so they should have made contact. However, I'm not been done. But
in Dubuque County, with the public health, I would like someone to follow up to make sure that that's being done. And who on the incident management team, is responsible for that, but I would like a report back on that to see whether they're going to be tested in a timely fashion here, because it's important to those family members and to the residents.
We agree, Diane, and we follow up on the positive, so that puts us in contact with the long-term care facilities whenever there is a positive. So I can definitely follow through and get back to you.
Thank you.
Stacy, as long as
Patrice,
you're on there,
this is Diane Hyken.
I'll yield to Diane. Go ahead, Diane.
Oh, thanks, Supervisor Baker. First of all, thanks, Patrice, for working on this targeted testing. I'm happy to hear that we're going to be reaching out to this many people. One question about the finances. I think you said that the county would be responsible for the staffing, and did you say security?
We would be responsible for everything but the collection kits and the testing itself with the lab. So with our staff that we have in place for the 3 days, and then the security as well, and then the location.
Do we have an
if
estimate?
They did charge.
I mean, I'm assuming we're good. I don't think we have spent a lot of the money we've been allocated, but I just want to make sure that
Correct.
we've got it all covered.
No.
And if
Yes.
we have an estimate, it would be good in case we have to do this again.
Absolutely. And that's what we're planning on doing. We're still fine-tuning everything, and that's part of the fine-tuning as well. I know Tom Berger has already talked with our law enforcement. I don't know if, are you still on, Tom? You might have had to drop off.
Oh,
so
I'm here.
I don't know. Oh, okay.
Yeah, we're working with the Dubuque Police Department to provide the security at the sites, and if we need to, we can invite or ask the National Guard to come in for assistance. But at this point, we think we'll handle it with our locals. Plus, we also have the
Okay.
We have the sheriff's office.
Thank you.
Well,
And we've got the PPE all covered for this initiative and everything.
yes, that's a priority for the state, so
We
the request went in this morning.
Okay. Thank you both.
I have one more question. Have we stressed to first responders and police how important it is to wear a mask? I see so many police officers out without wearing a mask, going into the gas station. I'm wondering if we've done that, Patrice, or how can we do that to make sure that people interacting with the public are wearing them?
Sure. And Tom, do you want to explain the meetings that you've had?
Well, they're following the state guidelines. We can follow up if there's certain officers or something that's not wearing it. Maybe it's a big push to put out, with all the increased traffic and people moving around. So we'll check and send that out to the law enforcement with the updated or the recent guidance and remind them and let them know it came up here.
Okay, I think it's hard to have people, working for the city and working for the county not wearing them.
And Tom does meet with the fire and the EMS on, Tom, my meetings are all mixed up. Is it weekly?
Yeah, every other week we meet with fire and EMS. So.
Okay, thank you.
Okay, Dave Baker here. I had as long as Stacy is on and Patrice, I think I'm going to the chat input here on Zoom. So I'm going to ask, there was a comment about turnaround on test results, that Mayo Clinic had results back in 24 hours. Is there a reason why we're not utilizing Mayo Clinic if they're able to get the tests back in hours versus days or weeks?
I can explain with the testing that we'll be doing Wednesday, Thursday, and Friday. Those collection kits are coming from the Iowa Department of Public Health. So we have no choice whatsoever to request that Mayo be, that we request those collection kits for Mayo. And also with the Iowa Department of Public Health initiative, they too will be working with LabCorp. It's my understanding that they're working with LabCorp, so they are not going down to the hygienic lab. And it was, again, my understanding the hygienic lab is the one that is very backlogged. But because of last week with the nursing home situation, the Board of Health did request that the testing be done immediately. So that's why we had to go through hygienic lab to get the collection kits from the UCL. Also with the Mayo, it's our understanding, Tom Beshin, you can help me with this. I believe it's $127 or $147 for Mayo testing. And also, Dr. Bobby Canero had reported to us last week that, again, Mayo he has heard through the medical health care providers that the Mayo Clinic is also starting to experience a backlog. But with our testing this week, we are getting those collection kits through the Iowa Department of Public Health. So they are designated to send these kits to the LabCorp, so we do not have a choice to send them to Mayo.
Okay, thank you. I'm going to go to another question that was raised on chat. There is word out in the community that there's an outbreak in the Marshallese community, which we have a significant number in Dubuque County. I think as a general question, I can't imagine that is a HIPAA violation because it's not specific. I know there's hundreds, if not 1,000 or more in the community. Any comment? Is there any merit to this, is the question?
As far as releasing any information at all, we cannot confirm nor we cannot we cannot confirm nor not confirm with our positive tests. So we're not able to say that yes, there is, or no, there's not.
Well, that kind of leads to the next question then, and it wasn't from the same person. Sure. Is our Board of Health bound to only do what the state of Iowa, and it's in quotes, approves? In other words, if something doesn't violate the law, HIPAA, whatever, is the Dubuque County Board of Health, or Dubuque County in general, bound to be satisfied with what the state is telling us, or can we put out information or do things that the state is not recommending? In other words, can we expand on what the state is doing without getting approval?
Well, there was a documentation last week that was sent out regarding that information. I believe it came, I'm thinking it was from one of the legislators. And what I did on that, it was an advisory. I'm just looking to see if I can't pull it up real quickly. An auditor advisory, Reynolds administration, not HIPAA, determines whether public gets the outbreak data, and that was from Rob Sand, who's the auditor of the state. I did forward that on to CJ May and had asked for clarification on that. And I've not heard back if we can go beyond what IDPH is telling us we can go beyond, or what IDPH is directing us to report on. So is CJ on the line? He is not. So I did send him that, and
he
so he can follow up with us. Oh, he is on? Good.
Yes, I'm here.
CJ, did you hear the question about the opinion or whatever it was from the state auditor, Sand?
I kind of did, Supervisor Baker. And Patrice did send that last Monday. I took a quick look at it. I mean, I think some of this is sort of borderline conflicting, but I think what they're trying to direct us is, you know, somewhere between not disclosing too much and disclosing nothing at all. So I can appreciate Patrice's position and wanting to be erring on the safe side of that. I other than taking a quick look at it, I did not dig any deeper into that as of now.
And I'm just following the directive of the Iowa Department of Public Health until someone tells me otherwise.
This is Susie Strout. Can I talk, or is it not appropriate for me to talk during this time?
No, you go ahead.
Okay. I appreciate that. I'm a numbers person. I think if we look at the numbers, if we're talking about certain populations in Dubuque, if we look at the state of Iowa, so far, if you have the breakdown of what the state has released, of the positive COVID cases, 8.4% are Asian and Pacific Islanders, when there's only 2.6 of the population of Iowa that are Asian and Pacific Islanders. So I think if we say we have a concentration of that demographic in Dubuque, then maybe we can assume that there's a breakout going on. I'm just looking at the numbers and what's been released.
Thank you, Susie. Patrice, I had another question, and I don't know if you or Stacy could answer it. And this came from an individual to me. It was regarding a potential exposure, and they were told, apparently they were qualified to be tested, and they were told to go to Des Moines for testing. And then there was something about a $500 fee. Have you heard anybody bring this up? Is there a $500 fee to be tested?
I have not heard of it. Oh, I'm sorry. Go ahead, Stacy.
I was going to say I've not heard of this either. This is the first I've heard of something like that.
Yeah, I've not heard of any cost whatsoever related to the Test Iowa.
Okay. I was relaying information to me, and apparently it's not always accurate. So thank you for that.
No, that's fine. Sure.
Patrice, Ann McDonough here. There's been a reference by Chuck Eisenhart that the Board of Supervisors on Wednesday could go into closed session to discuss some information in the closed session to be more informed about communities and outbreaks. Is that possible? First of all, is 21.5 as cited? I wonder if we can be sure on Wednesday whether that's the section we can use. And I'd like to know if you would agree with that a closed session to bring leaders up to speed on what's happening would be helpful.
I'm turning all of that over to CJ, Ann.
Okay,
and CJ don't know the legality.
Yep. CJ is still with us, so maybe he can dig into that question and get us an answer to see if we can, as leaders, know better the Dubuque situation for the county of Dubuque for Wednesday.
And Ann, again, I can't promise my availability on Wednesday. I mean, I'm just sharing that right now. But go ahead, CJ. I'm sorry I interrupted.
No, that's quite all right. That's quite all right. So specifically, what would you like me to look at, Ann, just so I can make sure I'm on I have this narrowed down enough?
Well, how could the Board of Supervisors go into closed session to talk about information about the health of our community in a closed session format? State Representative Chuck Eisenhart is indicating that under Code Section 21.5, we could go into closed session to be talking about information we might want to share with leaders as compared to just the general public, so we are aware of, we're not maybe going to be as constrained by some of the HIPAA requirements to know what the status is.
Okay. CJ, this is Diane Pate-Freiberger. If that's going to happen, can you look into if the Board of Health can be part of that conversation also? Or can the Board of Health be part of a conversation that maybe the Board of Supervisors cannot? If that's what the review of the actual laws, when you find that out, maybe the Board of Health can be informed and not the Board of Supervisors, but I would prefer having it done jointly.
Diane, Chuck's question does refer to the Board of Health and the Board of Supervisors. So I think that was the intent.
And I would ask if that was a possibility, if we could wait until Monday, because then if we are able to share additional information, we should probably have some test results back from this week.
Patrice, this is Diane Pate-Freiberger. To add to those testings, if you will be going into long-term care facilities and other populations to do testing Wednesday, Thursday, Friday. And I understand you're going to be very, very busy those days. So I totally respect that. Thank you for your time there. But I have a question. So if within 72 hours you find out that someone in those, either workers or residents within those institutions test positive, and it goes back to a question I asked earlier, then do you follow up with contact tracing and test those or is that a whole nother initiative?
Okay.
Diane, I could probably answer this on the contact tracing. If we go in and we get test results of additional positives, we would be going in to do additional contact tracing and working with that facility as well.
Or populations?
Yes, our population needs to be addressed, not just facility. Stacy, can you update your answer about population?
Correct. Yes. I apologize. It would be population and or facility. We definitely, when we work with any positive cases, we're looking at their close contacts, their employment, those in the household as well. And this initiative that Patrice is discussing about the testing this week, that's where we're hoping to target is those that are truly in need of a test and are in close contact with someone who is positive. We want to get them tested and we want to work with them. So if we start seeing additional positives, it would facilitate then additional contact tracing and working with both any population and or facility and or business.
And Diane, we will talk about that a little bit in more detail with our next topic that's on for the Board of Health, because we will need a motion on that one. So we will talk a little bit in more detail here real soon.
I also have a question. This is Diane Pate-Freiberger again. With the testing, and I understand that this is a separate initiative than opening up a test site in Dubuque. Where are we at with discussions with Crescent also? You know, they were awarded a large grant, and part of that they have earmarked for testing. Are they able to get their collection kits? Is this part of your testing and they don't need to request them? I just want to make sure that Crescent is in on this too.
Yes, Crescent is involved in this, and but not so much as this week with the testing, with what we have going on. But if we are able to expand this to the community, I know Mary Rose Corrigan has had discussion with Crescent, and it's my understanding that Crescent is still very low with their collection kits, but they are looking at trying to obtain additional kits to do more outreaching of the testing. So I know that Crescent, but it's basically been through Mary Rose Corrigan, has been in discussion with Crescent to see with their grant what can be provided for our community as well.
Okay, other questions for Patrice or Stacy or Tom Berger?
I guess I have a final question, and Tom and I visited a little bit over the weekend about this, but who is following up on businesses that choose to open or reopen? Generally significant more traffic this weekend. I think we have some confusion about whether or not we are an open community and an open county, or we are under restrictions and what those still look like. Questions about what's a greenhouse versus what's a farmer's market. Who is the contact person for those types of questions?
Ed, would you like to discuss that with Christine? Is Ed on?
I am on here.
And I know Terry Goodman has been excellent of getting information out regarding the proclamation as well. But Ed, can you address that?
To a certain extent. So Dubuque County, I think as we all on the call here know, are still under the governor's proclamation, us and 21 other counties until May 15th. So no, I am not aware from this weekend that there were particularly more businesses that have been closed that are opening their doors to the public. I am unaware of that. That I don't think.
Hobby Lobby is reopened?
I believe that Hobby Lobby was part of the
Again,
governor's...
it doesn't matter the specifics. I can list 3, and I don't want to do that at this point, but who is responding to that? Do I need to call non-emergency dispatch? I mean, who is following up? Do we want citizens to be, I would like everyone to be vigilant that we are still, under the restrictions, and that those are considered to be appropriately, for our own safety. Mm-hmm. Someone would think extreme, but all the same, our restrictions have not changed.
Correct.
This would be this Supervisor Jay Wickham. I mean, if you read the code, the Board of Health is responsible for these items. They have the ability to quarantine. They have the ability to test. They have the ability to make public statements related to the safety of the public. That's what the Board of Health's responsibility is, and the supervisors provide the funding, the guidance, and there's other departments to assist. But I think it's a Board of Health department edict, and then hopefully they can rally up the resources to make things done.
Okay, so maybe we should let's invite the Dubuque Police Department to join us maybe on Wednesday, and they can give us an update as to reopenings that they've been called to investigate. Also, I'd like to know how many parties have been in neighborhoods and whether or not we have law enforcement being contacted. That's been a question that's ripped through my neighborhood. I think generally people are using good choices and responsibility, but when not, what do we do?
Right. And Ann, our directive has always been since St. Pat's Day, March 17th, when all of this came into factor, that if any public had called us, stating that, oh yes, a restaurant or a bar was open, we were to direct them to their local law enforcement, and then their local law enforcement, whether it be in the county or in the city, they then would follow up with that agency or facility or restaurant or bar. So I would still say if you're questioning, not you, but if anyone in the public is questioning why is this business open, I again would refer them to their local law enforcement to follow up. And that was the directive that we were given on March 17th.
This is Ed Raber again. So I did put a star next to your comment there, Ann. If that is the pleasure of the supervisors, I would be happy to check to see if the police chief or his representative for the city of Dubuque or Sheriff Kennedy could either or both be available to discuss how that enforcement side of things have been going in a work session here with the board, or as just part of this agenda item. Is anybody hearing me?
Yes.
Yeah, we hear.
Okay.
This is Susie again. I have a question. So, because I still haven't, my orientation for the Board of Health is supposed to be tomorrow, and I'm not sure because I'm still so new to this whole thing. I witnessed this weekend, I think along the lines of Supervisor McDonough and what she was talking about, not necessarily businesses reopening, but businesses that may not assist the customers with helping with social distancing, large crowds, everybody bound together. Like, is that something that we hold the businesses responsible for? Or how do we go about enforcing this? I believe when we started the mask task force, Ed Raber volunteered to do a press release about what we were wishing about staying home, and if you can't stay home, wear a mask. I'm not sure if that, I never saw it. I don't know if it got out or not. But what else can we do about this?
This is Tom Besham. Yeah. We have, at the advice of the supervisors, the websites post, the county websites post not the mandate, but the guidance that both the Board of Supervisors and the Board of Health have issued. We need some enforcement, and that needs to happen through the local law agencies. So, you know, we can put guidance out there, but we can't force people to follow it. Just like we can't force people to wear masks at work. You know, I see some of the businesses are now saying, if you're coming into our store, you're going to wear a mask. More need to do that. That's the only way it's going to happen.
And,
Sounds like we do want law enforcement to take a role in this then. We want them to tell us what their expectations are, what they're willing to do, and maybe we're going to give them, at least ask them to work with us on direction. You know, I guess as the weather gets even nicer and folks are out, let's get an update. They should be willing. I'm sure they're willing to join us.
I will reach out to them after the meeting.
I think that was an excellent idea, Ed, and I think that could be an agenda item for Wednesday. You know, obviously, you make the contact and get with Don Sherman about having that on the agenda, subject to their availability. I would think Chief Dalsing and Sheriff Kennedy would be interested in you know, having this discussion. So thank you for that. Okay, I know that, I guess I want to ask if there's any other questions, comments. Was talked about some stores doing better than others, and I did get, we get this from one of our department heads, that at Menards, they're not allowing folks to enter without a mask. And if you don't have one, you have to go to the main entrance to get one before you enter. That's positive, obviously, and I think that's also fairly recent. But that's a good thing. I'm sure there's other stores that are trying to do the right thing, and then probably some that not so much. And you know, there's you know, word what tends to get out, social media. I think people are somewhat self-policing, and I know someone made the comment we need to be vigilant, and that's true. We need to be vigilant without being vigilantes. So I think having the discussion with the law enforcement is the way to go with this, and we can, you know, two things. We can hear what initiatives they have in enforcement, and they can listen to some of the concerns. So I would say to the public, if you have you know, concerns, get them to us or someone that, you know, or join the meeting and be involved in the discussion. Any other?
Supervisor Baker, this is Supervisor Wickham. Yes, I do have another question and comment. I'm happy to have the conversation about enforcement, and I think that is a component. But I'm also interested in the numbers, and I think the public will probably respond better to the numbers than they will some sort of enforcement criteria. So I'm very excited about the 1,000 tests that we're going to be having done, hopefully in the very near future. To date, I think we've had about 1,500 tests throughout Dubuque County, so that's a significant improvement. So I'm very, very pleased with all the efforts that have gone to make that happen. My question to the Board of Health would be, as you look forward, what are you planning? What is your next initiative for testing? I'm happy we're getting 1,000, but that'll help increase our percentage of overall people who've been testing in Dubuque County, but still a very, very, very small percentage of the population. What is our plan and what is our vision for the next round of testing?
This is Tom Beschen, Jay. As Patrice reported earlier, we have not given up on the Test Iowa local site. We we know that there's one opening in Scott County this week, another one opening in Lynn County next week. We have been told no at the moment, but Patrice and the group are continuing to push for that. That would open up some opportunities. When we have our Board of Health discussion here in a few minutes, we'll talk about another way to open up some opportunities, maybe not necessarily for testing, but for some additional help within the county. I guess at that point, anyone else from the Board of Health care to join in?
Tom, this is Diane Pate-Freiberger. In conversation, which we've done through emails with Dr. Canero, and he is actually in clinic this morning and was not able to join us. And that's why we've had this discussion in the past of having meetings when more of us would be available. But he has stated, as far as bringing Test Iowa in, yes, we all would love that. But if they would let us use their algorithm, for testing, that in itself would help expedite who is eligible, who is not eligible. And also, they would prefer to use a private source for running those tests. They meaning Dr. Canero, Dr. Vanderheiden, and they've had discussions with hospital administrators because of the turnaround time. And I know that Patrice just said that Mayo Clinic is seeing a slight backlog, but they're also working on that. And their backlog is from 24 hours to 48 hours. Theirs is not 2 days to 5 days out. And so with the difference in the cost from $26 for one run at the State Hygienic Lab to a test run at Mayo Clinic for $147, there is a difference in cost there. From what I understand from correspondence with our United States senators from the state of Iowa, they have stated that all testing would be covered by the federal government. So how the logistics of actually getting the test kits, it seems to be a big problem right now. But if we were able to start testing more, according to Dr. Vanderheiden, he would prefer a shorter turnaround time because of how backlogged they are down in the State Hygienic Lab.
Okay.
So Diane, are you recommending that we, move forward with another round of tests locally and using our own testing capabilities?
I've been recommending that for a couple of months now. The vote came on April 8th, and it was seconded, and the motion carried with a 6-0 move. That we should increase, but the difficulty with that is getting the test kits available. It's all centering on that. You can't just go buy them at a local store. You can request them through the federal government, through the state government. You can look online and you can't find any. So it would be ideal for us to do that. And actually the motion's been made so that if those do come available, that we can do that. But right now, those test collection kits are not available.
Yeah. Diane, this is Tom Beshen. If you go back to April 8th, the motion that was made was to secure more test kits. Following that motion, we found out that there were 18,000 test kits available through United Clinical Labs. Our ability to buy more test kits, other than going through a facility like United Clinical Labs, is very limited. And at that time, I checked, and even for the University of Wisconsin Health, they were 6 to 8 weeks out on getting test kits. or collection kits. So that motion was limited to getting more collection kits.
Tom, this is Diane Heiken, and I had thought the same thing, but I've actually been going back and reviewing the meeting. And when I reviewed it over the weekend on April 8th, that motion was actually to ramp up and get the testing site started within a week, as well as to secure more collection kits.
I disagree with that.
It's at about the 55-minute mark of that meeting.
Well, maybe I can ask a numbers question. Maybe I can ask a numbers question if anyone knows. So if we have 18,000 test kits locally, what is the adequate number we want in supply or inventory? Is it 100,000 and therefore we don't want to extend any, we don't want to use any 18,000? What is the number we should have in reserve? I think we all would agree it shouldn't be zero, but 18,000 sounds like a good number. If we could use 10% of that, we'd have 1,800 more tests, 1,800 more answers before the governor opens our county up in 10 days. What is the answer to how many supplies we should have on reserve?
Jay, this is Diane Pate Freiberger. Dubuque County Board of Health does not own those 18,000 test kits or collection kits is the new terminology. We do not own them, and they are owned by United Clinical Labs, not by Dubuque County or Dubuque County Board of Health. And they are in communication with the healthcare providers and with the both hospitals and Crescent. And they're the ones that have to release those. We cannot just go and take them from them. And they actually gave some to Patrice on Wednesday of last week to go and do the testing at that long-term care facility.
Yeah, agreed. Could the Board of Health place an order for 1,800, which is 10% of their inventory? Would that be appropriate? Why not do that?
We had a conversation, this is Patrice, and Ed, you can jump in, and Diane and Tom, I believe you were all involved in that. I had checked with, I'm trying to find my email here, with Lynn McGovern, who is the director of the UCL, and she, as Diane Freiberger just said, she did give us tests at no cost whatsoever to go over to the long-term care facility last week, which we really appreciated. And in conversation, and I believe Dr. Vander Hayden also joined the conversation, that she was our contact person, and that just as Diane Freiberger had said, those kits are not for sale. They are property of the UCL themselves, and they do have criteria of what those kits will be or the collection kits will be utilized for, and it did not fit our criteria of asking for additional tests. But I'll let Ed or Diane or Tom.
I hear that. I hear what they're saying. I understand they're a private company. I hear it. But the Board of Health is a public entity, and so is the Board of Supervisors. And we're responsible for the well-being of the Dubuque County residents. So what would be wrong with placing an order to secure a number? I'll propose 1,800, since it's 10% of their inventory. 1,800 test kits to further test Dubuque County residents in a methodical manner through medical professionals, not myself. Why wouldn't we do that?
And I'm saying we have attempted that. Right. But the request had come back.
I have not seen, have we placed a written request from the Board of Health for what I just mentioned? And why wouldn't the Board of Health request that in writing with the full support of the Board of Supervisors?
And you're talking, Jay, about making a request to someone other than United Clinical Labs?
No, make the written request to United Clinical Laboratories, unless it has been done in writing and I just haven't seen it.
Where will we do, who will actually administer? Assume they give us 1,800 test kits. Who will administer the test or collect the sample?
You bet. That's the next thing we work on. You got it. That's the next thing we solve. We just move down this path. Good question. I'm confident we'll solve that.
Well, we keep running that question round and round and round. So we need to know if we can buy them.
I think the Board of Health can solve it. If you want me to help, I can solve it. Get the tests, get the people to administer the tests, get the priority of the people you want to test, and move forward. We're on we got good momentum. Good momentum. We tested the nursing home. Another 1,000 tests coming in. What's the next step? Look forward. What's the next step? Be proactive. You're doing good work. Let's secure 1,800 test kits from UCL. Let's do it.
This is Ed Raymer, and just for some perspective and background, Supervisor Wickham, I don't think that we've asked in writing, and maybe that is an avenue to pursue. I would certainly assist Patrice with that if that's the pleasure of the board. And secondly, I believe these nasal swabs, the test for the virus that we're talking about right now, in other situations, like at the long-term care facility that Patrice mentioned that we did testing at last week, those test kits, the samples were collected by the long-term care staff. It wasn't by, although the test kits were provided from United Clinical Labs, their staff did not perform the test. The times when it becomes trickier, the serology antibody test that we're not discussing right now as part of this initial next step, that requires a full blood draw that would require phlebotomists and things like that at this time. So we're not talking about that. We're talking about something that probably a test that could be administered by trained medical staff to get a good sample. So I don't think that the staffing about that is the limiting factor, especially if this were to happen at existing medical facilities and things like that.
My request would be to the Board of Health. So I would really want the Board of Health, whether it's now and Supervisor Baker or Chair Bestian, you can jump in as well. I would like the Board of Health to address that. And if they aren't interested in addressing, I'd just like to confirm it. But I think that's a direction that I think I would encourage the Board of Health to pursue.
Jay, this is Diane Pape-Freiberger. I would be willing to entertain that motion with my fellow Board of Health members to see it, to in writing request that purchase from United Clinical Labs if they say yes, and we decide there is already a mechanism set up, and that would go back to the incident command team, and that would be to get a test site set up and ready to do these tests. So there is that system already set up. The only barrier to this whole process has been that we could not get test kits. So I would ask some comments back from my other Board of Health members on this one.
Diane and McDonough, the reason we haven't activated a test site collection like we have at Grand River Center on the and paper plan is because we've been told that our medical care providers have capacity, that the team doesn't wish to open a test site separate from that because capacity is there. Well, if the medical providers can't tell us they have capacity, but yet nobody can get a test, some of this I need an answer from medical providers. Someone needs to step up who's an MD, who's willing to say, you get me the test kits, I'll write the order, we'll get this information working together. I think we have some logistics here that no matter what the Board of Health wants to do, unless we're going to hire our own doctor who's going to do what we say, we still have some roadblocks.
This is Susie Stroud, and I could be totally, from what I understand, even if we get a doctor and write the orders, the labs have to go through that algorithm, and if the patients don't fall in line, they won't even test the kits.
Even at Mayo?
That's what I've been
they'll
told.
Test them. No, they'll test them.
This is Diane Pape-Freiberger. I've been in conversations here that if we are utilizing Mayo Clinic, they actually do not have the criteria, the priorities that our state hygienic lab has. They basically will test anything that's sent to them, is what Drew Vanderheiden had said.
So that's just the hygienics lab and maybe LabCorp and UCL that's only following those algorithms?
No. Back to United Clinical Lab is actually not running the tests.
I know, but the collection.
The collections. They will if United Clinical Lab, Dr. Vanderheiden has said, if the sample is going to be sent to Mayo Clinic, we do not need to follow the state hygienic lab criteria or now LabCorp's criteria, because they set up their own criteria. The place that actually runs the lab work is the place that sets up the criteria, not who collects it, not who distributes it, none of that. So in actuality, if we had earmarked these collections to go to Mayo Clinic, that could happen without the specific priorities or criteria.
Well, then let's request it in writing and let's get to this.
Where do we put them? At every emergency room, we give them 500 Dubuque County UCL test kits to go to Mayo.
And
that's a good plan to work on.
It's my understanding that, and someone can correct me if I'm wrong, the collection kits that UCL have are specific for the hygienic lab, the 18,000. And someone can double check on that, or I can double check on it. It makes no difference. But it's my understanding that the Mayo Clinic has their own collection kit, but that the 18,000 that the UCL has, again, it's my understanding, unless someone can help me confirm this, are only the collection kits that are compatible with a hygienic lab.
That information would make sense than the information I had that said that we have to go through this algorithm to release any of them or to even be tested, which is what I'm confused about.
Can we buy 1,800 test kits from Mayo Clinic and that they will do the testing if we get somebody to do the collecting?
I think that's a question. This is Tom Bishon. I think that's a question we need to have answered. And if we can, then we can entertain the motion to buy 1,800 or 2,000 test kits.
Or you can reverse that order. You can reverse the order. You can put a motion to buy 1,800 test kits and go buy them from the open market or from a UCL in Dubuque. Don't wait.
UCL
Jay, this is Diane Pape-Freiberger. This is Diane Pape-Freiberger, Jay. I was planning on making that motion. Thank you very much for your input on this. So, as a Board of Health member, I entertain the motion.
Hey, Diane, Diane, can you hold up just a minute? Dave Baker here. I want to, before you do this, I want to be able to move the meeting and turn the chairmanship over to Tom Besch, and we haven't done that. I know that we have joint issues with the Board of Supervisors and Board of Health. I think for something specific like this, I'm going to see if there's any last questions in the general discussion of the county emergency response team on COVID-19. And then we'll move it to Tom Beschen, and then you can do your thing. So
thank you.
I have no further questions.
All right. I'm going to ask if there's any, I know we're having considerable discussion on the testing. So any other questions, discussions, anything anybody wants to bring up in the general part of this under agenda item A? And I guess if anybody wants to speak, they can raise their hand on Zoom. We'll give a little bit of time here to see if there is anyone. Okay, we're gonna move to item B on the agenda, Board of Health update. Item number 1 is contact tracing. I am going to turn the gavel over virtually to Chairperson Tom Beschen of the Dubuque County Board of Health.
Thank you, Supervisor Baker. I would suggest that in light of the momentum we have on the question of testing, we move the contact tracing to the second on the agenda, and I would like to get right into the testing question rather than lose the momentum we had from the previous discussion. So, Diane Tate-Freiberger.
First, I'm looking at the screen. Val, are you still on so that we have a quorum here? Okay, I see her. She just waved at me.
Yeah, we have 6 on. We have Val Pecos, you, Diane Heiken, Todd Lang, Susie Stroud, and myself.
I make a motion to seek purchase of 1,800 test collection kits for COVID-19 from first priority to be able to purchase them from would be to see if UCL has some that we could purchase from, or from Mayo Clinic. That would be the second place. The third place would be any other private lab out there that we can purchase these test collection kits from for COVID-19. And they would also need to be able to, the private labs would also be able to run those the samples once they receive them. And we would need to know from those private labs, other than Mayo Clinic, what do they charge? That's a motion.
I'll second.
That was hi, Val. Okay. I'll open it up for discussion, but I think we need to be very clear on this, that are we looking for collection kits that can be run at Mayo Clinic, or are we looking for collection kits that can be run anywhere?
I'd first prefer that we obtain the collection kits for Mayo Clinic, because we already know what they're going to charge, and we also know what their criteria is, which is basically none. And we also have a system already set up between United Clinical Lab and Mayo Clinic for them to receive the samples given to them.
Okay, so this would involve finding 1,800 Mayo Clinic capable test kits or collection kits. Are we concentrating on Mayo Clinic because of their ability not to follow an algorithm?
Two things. One, they do not have the restrictions that State Hygienic Lab has.
Okay.
And the second thing is they already have a working rapport with United Clinical Lab in Dubuque. It would definitely expedite the collection and then the transfer of that collection to the private lab at Mayo Clinic.
So Diane Tate-Freiberger, this is Diane Heiken. I just want to clarify. About 10 minutes ago, I think maybe Patrice was questioning whether the kits at United Clinical Labs could be used for anywhere other than the State Hygienic Lab. So you're saying now that you know that UCL kits are already going to Mayo for processing?
There are a number of them going there right now, yes.
Okay, then they already have that ability. It seems like that answers that question. They have that relationship. I am all for this moving forward. Last week when we were discussing testing, the long-term care facility, I think that during discussion, I was thinking very small. So let's try to have 200 on hand if we can, just in case another situation comes up, like that one, that same scenario. But 1,800 is better. New avenues are opening up all the time. So I think if we can secure the test, we're being proactive, as Supervisor Wickham said. There is also a new initiative. Pharmacists can now order and perform testing, including the serology. The Iowa Board of Pharmacy, I think, is going to be issuing some guidance tomorrow. I know there's one pharmacist in the state that is working on that. That was a federal proclamation, I believe, by President Trump on April 8th, April 9th. No model has come out yet, but there are all kinds of different avenues that are opening up that we may be able to get our hands on tests.
Thanks, Diane. To clarify, we are talking nasal swabs. We're not talking serology. We're talking nasal swabs in this motion.
Yes, that is correct. I should have clarified that. With the serology, if and when Dubuque County would decide to start doing that, United Clinical Lab actually can run them themselves.
Okay, so the motion in front of us deals with nasal swabs.
Yes.
Okay, and our first option would be our first choice would be to purchase from United Clinical Labs. Secondly, would be to expand that to anyone providing swabs that are capable of being done at Mayo.
Right. And this is Patrice, and I'm glad you add being done by Mayo, because it's still my understanding with the United Clinical Lab, they would probably have collection kits that were compatible with Mayo, but it's still my understanding that the majority, those 18,000 that they had talked about, were for the hygienic lab in Iowa City. So I do appreciate that clarification that those with UCL, the request would be those collection kits compatible to Mayo Clinic. Thank you.
Okay. Okay. Any other discussion?
This is Todd Lang. Can you hear me?
Yes, Todd.
Yeah, I'm definitely in favor of doing something where we can be proactive. Just a quick question. With these collection test kits, like how many different varieties are there? This is just what I'm trying to understand, because it sounds like UCL has stuff that's compatible with both the state hygienic lab and Mayo. Like, is there a variety of different type of collection kits that are compatible with different testing providers? That's what I'm trying to get clarification on.
Diane, do you have an answer for that?
Yeah, I do have an answer for that, and that is they have a virology. It's like a solution that has actually the virus in it that they want to put this, like when they do the test kits at a place like a nursing home, okay, they actually allow the staff to go ahead and do the swabs and put it in a basic solution, and then they take it and add this virus, actually a virology, a stabilizer, to that before they are shipped anywhere. And it may vary from lab to lab based on how they're going to run that test when it gets to their site. So there may be a little bit of a variance there between how they have split those out at UCL, from 400 to make 18,000, or whatever the number was that they did. So Mayo Clinics may be more concentrated because that is the way how they want to run their sample, how they want to run the sample.
So it's a matter of how the sample is packaged that has to do with how the lab works.
Pretty much, they're all these nasal swabs, and they're all test tubes, and they all have a solution they're going to go in. And so it's based on what the lab themselves want in that test tube that comes to them.
Okay.
As far as solution, they all want the swab in there, with the test, the sample. They all want it that same way.
Okay. All right. Any other questions?
Todd, did that answer your question?
Yes, thank you, Diane.
Okay.
Okay, well, if we have no other questions, the motion before us is to purchase 1,800 collection kits from the following vendors in order. UCL, I guess I'd state that those collection kits must be Mayo Clinic lab capable kits or compatible kits. Try to purchase from UCL, then go to Mayo directly or any other provider we can think of or can find. Does that sound like what you were saying, Diane?
Yes.
Okay. All in favor, and we'll do a roll call vote. Val?
Aye.
Diane Pape-Freiberger?
Aye.
Diane Heiken?
Aye.
Todd Lang?
Aye.
Susie Stroud?
Yes.
And I will vote aye. So that is 6-0. Motion is carried. Now, we will have to get with Diane Pape-Freiberger's. We're going to have to figure out the logistics of placing this order. It would have to come from, I guess, officially from the Board of Health, so we'll need Patrice's help in writing the order. Second item that we wanted to talk about today was contact tracing. And I'm going to call on Stacy Killian and Patrice to give us a little background into this concern or question. The issue is who is doing the contact tracing and an offer that's once again in front of us from IDPH to take that over. So, Stacy?
Sure. No, I'll begin. This is Patrice.
Okay.
Thank you. The Iowa Department of Public Health has once again presented the option for all counties in the state of Iowa to request IDPH to take over the COVID case investigation and follow-ups and allow the state resources to be used in the mitigation efforts. And this was offered to us initially last Monday, I believe, and they reopened it because of the increased positives that were occurring across the state of Iowa. So after discussion with both Stacy and Tom, we are requesting that Tom Beshen, I had briefly talked to Tom on this. We are requesting that the Board of Health would make and approve a motion to move forward with this request to restructure our local public health efforts to focus on broader preventive strategies and then additional contact tracing and education outreach to individuals exposed, and then additional health support to local providers and facilities. And then with the increased cases that the VNA has prioritized their efforts to case investigation and follow-ups, we believe that the local community would benefit further by expanding the reach of our local public health efforts. And the Visiting Nurse Association has been tremendous throughout this crisis, and they've expressed their willingness to assist in the community in whatever capacity that the Board of Health directs. So IDPH again contacted us, and we are able to turn the case investigation over to the Iowa Department of Public Health that would free up the communicable disease nurses for other preventive interventions in our community. And it's our understanding that the requests have been very, very welcomed in the other counties of the state of Iowa, in that Iowa Department of Public Health has now established 3 teams of 50 members each to concentrate on this effort because counties are turning the case investigation over to them. But with that, I will let Stacy then add additional information.
Thanks, Patrice and Tom. So, like Patrice said, this is something that we discussed when it was brought to Patrice's attention. And the VNA is currently keeping up with capacity. We are getting much busier. Right now, we currently have anywhere from 2 to 4 staff dedicated full-time every day, 7 days a week to do the case investigations. They get very lengthy, making sure that we're not only contacting the patient and looking into their close contacts, but also contacting the testing facility, EMS if they're transported. So it's taking a lot of our time to where almost our sole focus is this. I do agree that there would be some benefit in allowing Iowa Department of Public Health to take this over. I think there's a lot more that we could do to help support, especially some of the issues that have been brought up this morning through the Board of Health and the Board of Supervisor meeting. I think there's more that VNA could do if we weren't doing this. So, however, like I said, we are keeping up with capacity, and we are willing to do whatever you see fit, whether that's stay with the contact tracing and or looking into diverting some of our resources.
Stacy, this is Susie Stroud. Is it okay if I ask questions? Are you done? I don't want to interrupt you.
Yes, I am. Yes.
No, that's fine, Susie. This is Board of Health portion of the meeting.
Okay. So here's my question. If we're going to do more testing, we are going to find more positives, and you say that you're keeping up now, chances are that's not always going to be the case if we get a rush of positives. Are you saying that you would like IDPH's help?
I think there's a benefit to that because I do agree. Right, I can say right now we are keeping up with capacity, but I am adding additional staff every day to the case investigation and follow-up portion. You're right, if we do increase testing, which is the directive of all of us, we are going to see a lot more positives. I think there is a benefit that VNA could help with if we weren't tied to the restrictions of doing the case investigations and the follow-up, but helping in other capacities.
Okay, I just wanted to make sure that was clear. Okay, thank you.
And this is Diane Heiken. So we would not be doing any contact tracing here locally. Is that correct?
That's correct. If we do this, Iowa Department of Public Health will take over all the contact tracing, including the follow-up, the contacting of close contact businesses, the same thing that we would be doing, that we're doing currently.
But you as health leaders would have access to any trends that are being seen?
We would, and we would also have access to all the positive cases, so that piece would not go away. We would still be able to see the positives come through the state-wide system, which is helpful for us.
And do they have, how is their time? Like, are they going to be able to start this right away? Is there going to be a lag time? Is the information coming through? Is that coming through a database so it's like real-time stuff? Or is there going to be a lag in it?
Go ahead, Patrice.
I was just going to say, so I contacted IDPH and I had said, if this is approved and I contact them as soon as I hang up on this call, when could we turn over the responsibility? And they had informed me that it usually takes, from their past requests, it takes about a day or two to turn it over. So that would even then occur before our Wednesday testing starts. And then that's when they had informed me that they have 3 teams of 50 individuals on each team. So they're actually believing that their contact will be immediate with any of the cases that come in. So Stacy, I can turn it back over to you.
And that would be my understanding as well, Susie, that they would follow the same guidelines that we do, that we would, as soon as we get the information, we start the investigation. In some cases, I think we're probably a little faster because we have a great relationship with our providers. And so there are cases where we will be notified of a positive case prior to the state notifying us, and we've been able to get a jump start on some of those cases, but that's not the routine.
And this is Diane Heiken. One last question, I think, and then I'd be prepared to make a motion. But if we find out it's not working for our community, if we do this, then we could, again, pull that responsibility back to our county. Is there any kind of contract with them when you do this?
I don't believe there's a contract, but Patrice better answer this one.
Yeah, we just notified them if we want IDPH to move forward with it. We were informed initially that it had to be all or none. We could not request IDPH to do, like, let's say, cases that come in on Monday, Tuesday, and Wednesday, and then we would follow up on Thursday and Friday. So they did tell us, they told not just us, they told all of the counties in the state of Iowa that it was all or nothing. So we had to tell them to take over, or we had to hold on to it on our own. I don't know if they I don't know if they would release it back to us like in 3 months if we requested that, or I don't know if they would actually turn it back over to us in 3 months to do. Because I know that this initiative was based on increase of testing going on, or the positives coming in right now, and they knew that a lot of the county health departments are not fully staffed with additional people that can do the case investigations. But it's my understanding that it has been a popular request by other counties in the state of Iowa.
And again, this is Stacy. And again, we're comfortable continuing on with contact tracing and or doing this motion and moving forward, giving it to Iowa Department of Public Health. I think there's a lot that we can do for this community. Should we turn it over, I think we can really look at some of the restrictions that have been placed on us by Iowa Department of Public Health that allows us to do additional contact tracing, spend additional time with some of our businesses that need guidance and that want that information. We still continue with the call center. And so we have a good idea of what some of the questions are out there in the community. And I think there's a benefit to having additional time to do those things. But I can see this in both aspects. So we are prepared with whatever you vote to agree with.
And again, this is Patrice, and I guess if, my personal opinion would be that we move forward with IDPH and utilize the Visiting Nurse Association staff and other capabilities, because I'm just thinking if we are able to obtain those additional testing that the Board of Health will be requesting, that VNA then that will free their staff up to help us with those any of the testing sites that might be occurring in the future, and then it will also take the pressure off of us over bombarding the VNA communicable disease staff nurses if we do receive additional positives with every site that we test.
This is Diane Heiken again. Oh, go ahead, Diane.
Go ahead, Diane.
Okay, so I just wanted to clarify, is it just for the COVID-19 contact tracing, or are you turning over all communicable disease contact tracing?
No, it's only for the COVID-19.
Okay, and do we know that the state's protocol would include contact tracing to employers? If they were in close contact?
They would follow the same guidelines that we do.
Yeah.
Stacy, this is Diane Pape-Freiberger.
Sure, Diane.
To begin with, I feel that VNA has been a great partner, and you and your staff have been doing great work. I do not have any difficulty with that at all. I would just be concerned, this is my only concern with this, in that when the contact tracing is done by a IDPH, something outside of our county, someone outside of our county, to make sure that we are getting that information back, that you are getting that information back, we are not given that information, but that you or the incident command team, all four of you probably should be getting this information back, to make sure that that information is coming back and we still have the availability to isolate, make recommendations for testing to certain individuals. I just would not want that local control that we have now being given over to the IDPH and them not following through with what we recommend.
Thanks, Diane. I agree. That was a struggle that we had when we initially talked about this and what would provide the biggest benefit to the community. I do know, from my understanding, Iowa Department of Public Health would do things the same way we would. To me, I am a little leery because it is somebody outside of our county. We know our medical providers. We know our community members. They know us, and they've developed relationships with us over the years. So I can see where that would be, and that would be my hesitation as well. I do see a benefit because we will continue to see the positives come in exactly like we do now. So we will get email notifications every time there is a positive case, and we will have the ability to go in and look at that positive. And so it gives us, I think, maybe a little bit more time to do additional contacting of some of these people. I think sometimes it's limited at the state level, and we're bound by time constraints, and this must be done by a certain time, and so it doesn't allow us as much as we would like to nurture that and find out more. And so I think this gives us a little bit more opportunity by still keeping the same information in-house. So we will still see all of that. We will still see when Iowa Department of Public Health completes the investigation form, it does get uploaded just like it would if we did it. And so we still are privy to some of that information. And it might be a good opportunity for us to look and say, as a community, what's missing out of this case investigation? We do know that Iowa as a whole does less than some of the other states. Maybe this is an opportunity for us to look in more, start paying closer attention to some of their businesses and help provide the support on the back end that we may not have the time to do now. So I think there's a huge benefit into that piece, but I can also understand the benefit in keeping it with VNA because of the relationship we've built in the community and the trust factor and things like that. So it's definitely not an easy choice to make, which is why we feel that we could do whichever way the board would choose.
Do you have
and
staffing?
Diane,
I'm sorry, Patrice. Go ahead, Patrice. Go ahead.
Okay. I was just going to say, and Stacy and I have had multiple conversations with this, and we do know that if it is turned over to IDPH, again, like Stacy said, we will get all of those results, and it will free up the VNA staff to do additional positive things, like what Stacy was just saying, the way it's operating now. We have a lot of time constraints that this has to be done now within X amount of hours before noon tomorrow, that would be taken off of their plate because IDPH would be doing that, and that then Stacy and her staff can concentrate more on the population that we're seeing those positives they are coming from. And I do truly believe that if we do turn it over to the state, and if Stacy or any of us would have any questions about a case, we do have a regional epidemiologist that Stacy and I talk to about daily, that that person, we could still pick up the phone, ask them any question, ask them any share any concern that we would have with our regional epidemiologist, just as we are right now. The advantage would be the time constraint and the staff, the limited staff that Stacy has right now, especially if we start to see an increase, which we probably will, here in just a couple of days of the positives. But again, if we allow IDPH to do that case investigation, then it frees up Stacy and her staff to concentrate on other topics and items that we have not been able to do because of the time constraints with the case investigation. Sorry.
So, this is Todd, and I have a question. I was just curious, Patrice, you had mentioned, that other counties are definitely utilizing this or very interested in it. I was just curious, how new is this? Do we know of other counties that have sort of a history with this, if you will, or have gotten any feedback on how the county builds a working relationship with the IDPH as far as turnaround and timeliness of information sharing? Or is it just too early in the process to have ascertained any of that?
Well, I can ask Stacy, but what I do know is that this was, it is a brand new initiative as of last week or the week before. But Stacy, have you had an opportunity to talk to any of those counties that have turned it over? I have not.
I have not. I know that Polk County is one of them, and Muscatine County, I believe, is another one, is my understanding. I have not talked to either county. I know I've run across personally just some mix-ups in data where we had gotten positive cases that belonged in one of those counties, and Iowa Department of Public Health assured me they would be contacted within that time frame. Is that a guarantee always? I don't know. I guess I would assume yes. If they hold us to that standard, I would expect that their standard would remain the same, but I have not personally talked with any of the counties regarding this.
Patrice and Stacy, this is Diane Pape-Freiberger. 9 days ago, you, through the EOC, had requested a strike team to come in. Is there any knowledge? Are they coming? Have they given you a no on that yet, or a yes on that yet?
They have given us a no, and that's
okay.
what the opportunity to do the testing that we are doing this week is more or less the compromise.
Okay. And so that's saying they would have brought these individuals in to do contact tracing there, but they're out right now. So with the number of cases that we're looking at, with the number of testing that we're going to do, Stacy, staffing wise, is that going to, are you going to have to come back to us in a week or 2 weeks to ask for more help if we would vote this down now?
That's a hard question to answer, Diane, because I don't know what we'll look like in 2 weeks. Looking at the numbers today, we've doubled since last Monday. And so yeah. I would assume, just based on the last few days, we're averaging in the double digits every day now. And right now, our staffing levels have been able to maintain that. I have 43 staff in 2 offices, and I can direct a good share of them to assist in this. The city and our public incident command team has been very good at asking what I needed and looking in advance. And I can say right now we're good. I don't know what would happen, because with the additional testing, would it all of a sudden go from 152 to 800 in one day? That would concern me, because that would be difficult. And it's hard to predict this disease. I can say that I'm very forthcoming with the incident command team, with all of you, and letting you know where I feel like we are. We do have a surge plan in place, and we're getting close to hitting that, where we have enough staff backed up in order to do what we feel is coming. But I couldn't say that would be a guarantee, because I really don't know. I hope that we can plan in advance and we get a good idea, but it's hard to determine.
But an increase in the requirement for contact tracing will prevent you from being able to do other things within the community. Is that correct?
It does. It definitely limits. The more cases we get, the more staff I have to direct, and that has to be prioritized. And so that's where most of my staff's focus is right now.
Okay. This is Todd, and I have a question. I assume if IDPH takes this over, the same sort of protocols will be followed, right? Because what VNA does for contact tracing is dictated by the state. Is that correct? I just want to make sure I'm understanding that.
Yes.
Yeah.
Stacy, this is Diane Haken. Would it also be helpful just to have more people hired in Dubuque to do this, or would that not be a preference for you?
Can you say that again, Diane?
Would it be helpful for you to have more local employees hired to do the contact tracing, or is that not your preference?
I don't think right now that's a need. I really don't. I think we have the resources we need right now, and I think even trying to hire and orientate on a short-term basis for however long this goes on, it would take me more resources to go that route than it would to continue what we're doing. And again, I can't say it enough. We would support whichever way you go with this. We feel we are doing the best job that we can, and we can continue to do that. And we can also continue to go into a different route if that's what you see fit. But in terms of VNA and our capacity right now, I believe that we are doing a good job at keeping up with the state resources, the local questions, and I believe that we can continue to do that as well.
All right, Stacy, I agree that the VNA is doing an admirable job with this right now. I think bringing this to us at this time ahead of a surge is the right thing to do. And now that we've had the discussion, I would ask if the Board of Health is ready to make a motion that we approve the transfer of contact tracing to IDPH.
So moved.
That Val?
Yep.
Okay. Do we have a second?
I'll second. This is Susie.
Susie? Okay. We've had a lot of discussion. Is there anything else before we call for a vote? All right, all those let me do a roll call vote again. So, in the same order, we have Val.
Aye.
Diane Pape Freiberger.
Nay.
Diane Heiken.
Nay.
Todd Lang.
Nay.
Susie Stroud.
Yeah.
And Tom Beshan, aye. So it looks like the motion does not move forward. We are tied 3-3. So I guess with that, Patrice and Stacy, we'll keep the contact tracing where it is. Thank you very much.
Thank you.
Thank you all.
All right, thank you. Supervisor Baker, that is the conclusion of our agenda.
Okay, thank you, Chair Beshan. With that, we'll move on the agenda to item D, MHDD Fund Balance Report. Oh, I'm sorry, I missed one. Sorry, I got too many notes on my agenda here. Item C, Dubuque County Emergency Loan Fund. You know who's giving the report?
Yeah, Supervisor Baker, I asked to put this on the agenda, and there's an ensuing document if we could have that eventually displayed. And then possibly Ed Reber can lead the conversation, and I'm not sure if we've got other people from UCIA, Greater Dubuque, or NICC on the phone, but Ed might be able to coordinate their comments as needed if the board would have any questions. But Ed, would you like to organize the discussion around this?
Sure. This is Ed Reber. Thank you, Supervisor Wickham. Supervisor Wickham had contacted me towards the end of last week asking about providing a similar small business loan initiative similar to what has been operating for a few weeks in the city of Dubuque through Dubuque Initiatives, a local nonprofit organization that focuses just on the city of Dubuque. They started a program to provide up to $10,000 in a loan to small businesses. There were a certain number of stipulations about how that would work. They have been, based on how they've worked the first several weeks, they've revised that a little bit. So this is information before you represents a revision there. And I am providing this, my suggestion today is that this is an information item for you. If there's interest, it can be brought back for action at a future near meeting. The Dubuque Initiatives program provided was envisioned as a bridge loan for local businesses that had applied to one of several different state or federal programs that would provide some resources for them, and recognizing that sometimes getting those resources may take some period of time even after you've applied, and this bridge loan was there to be literally a bridge so you could get those resources. Initially, they thought that it would be paid back immediately upon getting those resources. While that sounds great, apparently the nuances of actually implementing that and some requests from some of the businesses that did participate led them to what I'm going to call version 2. So as I've said, the Dubuque Initiatives program serves just the city, businesses inside the city of Dubuque. To date, they've had about just under 40 loans. The maximum amount that can be requested in this loan is $10,000. Not all of them, I guess, have been for $10,000, but in general, they've now got to just under $400,000 in loans. There have been a number, I think around seven inquiries from businesses that were not in the city of Dubuque, but were in Dubuque County, asking about their eligibility, as they called the hotline that Rick Dickinson has mentioned to this group several times here in the last month. And so they were told that the Dubuque Initiatives program was only for businesses inside the city. So what is before you is an information item is, and by the way, although that is a Dubuque Initiatives program, it is administered by ECIA, and I believe that Matt Speck from ECIA prepared all of the information that's in the packet and is on the call today. The nuts and bolts of it, and Matt may embellish this a little bit more, is to provide some sort of small short-term financing for businesses as they're in a jam. They may or may not have already received some state or federal assistance, but that is the gateway. What they're doing, if I could summarize it, would be to allow businesses that have applied for state or federal program resources to also apply for this fund. It has a maximum of $10,000. What they do is they've just made that a 3-year loan. Could be paid off early if that's what the business wanted. But the first 6 months of the loan is no interest, no principal payments. So essentially you're sitting on those resources for the first 6 months. And for the final 30 months, the entirety of the note would be amortized over those 30 months at 1% interest rate. ECIA is proposing a 0.3% fee for doing each of these loans for $10,000. That ends up being a fee that's just under $340. And they also set up the business an automatic transfer so that they're not out for that small amount of money out trying to track down checks from people. You have to have it set up with an automatic transfer. So the issue is this a valuable thing that would be beneficial to businesses in Dubuque County that happen not to be inside the city of Dubuque? The end of the week, I had an opportunity or tried to connect with a couple of our partner organizations around the county. I interacted with Jackie Ray at Dyersville Economic Development, as well as by chance with a former lender that's still very engaged with us all, Nancy Dunkel. I received some positive feedback. I think that there are lenders that are making loans currently to businesses out there, whether those have to be branches of other banks or the banks from those communities. So I think there probably is some desirability about having a similar local loan program like that. So with that, that's where that came from. This is just offered up for your discussion or your your thoughts, and if there is some real interest, I believe that ECIA could implement this for the balance of the county relatively easily. I would turn it back over to you, Chairman Baker, for comments from some of the others.
Okay, thank you, Ed. All right, we have this presented and for informational purposes and discussion, so let's go ahead and tee up the discussion on this. Either Supervisor McDonough or Supervisor Wickham. I know Supervisor Wickham has talked about it briefly. Questions or any additional information? I have one question. Has this? I understand this is you know, the initial discussion on this. Has the we typically with contracts would have our county attorney CJ May review it. Is that something that would be proposed after this discussion today, or has that already happened?
I have, by email, have let CJ know that this is on the agenda. I don't know if he's actually had a chance to particularly review this one. You have some ongoing contracts with ECIA, but I've already brought it to CJ's attention.
Okay, and then if Matt Speck is on, can we explain the difference between this program and the current program that we have? We have a revolving loan fund already in place, and I actually thought this was when I first saw it, was a renewal of that. I think we have the program, if my memory serves me correct, has a 2% interest. There wasn't a lot of businesses taking advantage of it, but it was there. And I think recently the city of Farley, I believe, did utilize that. So can somebody explain the difference between that program and this?
Yeah, Mr. Baker, this is Matt Speck with ECIA. So the fund you're talking about is through USDA. That's the Dubuque County Revolving Loan Fund. The issue is they're not going to allow us to use those funds for this type of loan. I did talk to Steve Lucina, who is our USDA rep, and asked if we could do something like this with really no collateral. And his response was, at this time, we can't use those USDA funds for a loan program like this.
Okay, thank you for that.
Yeah, and maybe, Matt, this is Supervisor Wickham. Maybe a good news of that is I believe that term of that loan through the USDA will expire within this upcoming fiscal year, and the balance of those funds would be available for our general fund to be used in any manner the board seemed appropriate. And so, and I think the fund balance is probably in the neighborhood of 700 to 800,000. Matt, you can verify that, but that would give us plenty of liquidity or plenty of funds available to do a program like this, for example, for 200,000 in fiscal year 20.
This is Ed Raber. Just as a quick follow-up to what Supervisor Wickham said, the USDA, which oddly is a major source of revolving loan funds across the nation, what they do, and you can correct me, Jay or Matt, but just for clarity, what they do is they have loaned the county some money, $700,000, $800,000 at a very low interest rate, I think 1%, over a long period of time. And as the funds have been loaned out and then repaid at a slightly higher amount, what you're able to do is essentially pay that loan off. And so at some point, the repayment is sort of yours, and the USDA gets its original money back at 1% interest. So as Supervisor Wickham notes, you're at the cusp of, from a long time ago, having this money be yours as opposed to still obligated by the USDA. Is that right, Jay?
Matt, do you want to comment first?
I think so. Again, I will need to get clarification because I think yours is the first one we have coming up where it will be completely paid off. So.
Yeah, so my understanding is that in the near term, whether it's this fiscal year or next fiscal year for sure, the term of the loan will be done, and those funds that are there will be available for the board to use at our discretion, either continue the program or make it more liberal or do something. Another comment from other colleagues is that, so Dubuque Initiatives, it's a private nonprofit that's associated with the city of Dubuque. They do a lot of administrative functions of that. Already is awarded $400,000 worth of funding to small businesses only in the city of Dubuque. Our neighbors to Illinois, to the east, Joe Davies County, has just created a program for a grant, not a loan, a grant for up to $5,000 for $250,000 total dollars. And so we by no means are the first at this, but I think it shows you the demand for it, and I think the equity I think those programs are in need, and I think our Dubuque County businesses would greatly appreciate having a program like this available.
Okay, a question was meant. Jackie Ray was mentioned from the Dyersville Chamber. Is she in the meeting?
She is not. She is not here, and she. I did reach out to the chamber as well. Jackie is from the Dyersville Economic Development Organization, a sister organization to the Dyersville Chamber.
Okay.
Yeah, and we have a partner group, Supervisor Baker. So there's a partner group that meets, and there was about roughly 20 to 30 people on the phone from both Illinois, Wisconsin, and majority of Iowa. Includes all the economic development people, the chamber people, ECIA, Main Street, on and on. And they were talking about just updates of the program, and my comment was I would be presenting this to the Board of Supervisors on Monday. And just a quick little comment between multiple people was like, great, yes, we need that. And then I know of just through all my own workings with NACC in the small business community, there's probably about a half a dozen businesses in Dubuque County that have already requested this through Dubuque Initiative that have been denied. And I'd anticipate we'd probably have another maybe 10 at the most. So, no more than half the total applicants that we received for the city of Dubuque, and that number was roughly 40. I don't think we'd go past 20 in this specific program. But we'll wait to see. But I know the demand is there for a few of these loans right now, and the economic development community is in support.
Okay. I think it would be helpful if we're going to, I guess I'd like to see, I have some interest in this, but I would like to have County Attorney May review it as it's a contract, and I think that's a good practice for us to have his review. And I would like to have someone that maybe could either was turned down or someone who is aware of businesses being turned down that are domiciled in Dubuque County, not in the city of Dubuque, and establish that the need is there. And I don't have any doubt that that's the case, but I kind of would like to hear it from the horse's mouth. So no offense to anyone else. So I think having the experts involved in the discussion is good practice. So, and I guess
Supervisor McDonough.
Go ahead, Ann.
Right, I am here. A few things. This is a 3% fee, as I see it, Ed. Correct? It's a 3% fee that's going to be billed monthly by ECIA. That's what it says in Section 3, there's a service fee of 3%. They're going to track time, but it's up to a 3% service fee. Also, the time of the period, I would like to have it not be unended and not be until we terminate this. I'd like to have it be for a period of time, so that we have a contract term that begins and ends. We don't generally do well as a county, in my opinion, of ever closing things. So we can put, 180 days or 1 year, but I'd like to see the time period that this program's being offered to have an end date. I also would not, I don't think that I want to have, being a small business owner myself, these grants are for $5,000 minimum to $10,000 maximum. I am certainly willing to go with what the professionals are telling me. I don't need and would not want to have a small business come before us to be an example of someone who might need these funds. I would, certainly trust Supervisor Wickham if he knows of 7 that have been denied through the Dubuque initiative. We should be here at the table. This makes more sense to me than the USDA program. I like that ECIA is going to be administering this because I think they do a good job. They have great outreach into the more rural areas of our counties and seem to have a good pulse on what the needs might be there. They're frequently, they work directly with those cities better than some of the things we do. So, but I do want to point that it's a 3% fee, and I would be happy to have this come back before us. I'm sure that we could be ready probably for Wednesday, that the county attorney can look at this rather quickly. It's pretty straightforward.
That, the beginning and end, that's a great idea, Ann. Thank you. And do you have a suggestion on what that end might be?
It could be for a period of 1 year.
Now, keep in mind that would be for originating loans, because once they do that, they are still involved with, even though they've tried to streamline that by having the funds be a automatic fund transfer, we would be looking at a 3-year time window of how long the loan actually lasts. So, I mean, at some level, the relationship with the ECIA on managing this would be for the life of these loans, which is 3 years. But in terms of originating those loans, perhaps that's a shorter time. Maybe that's a year, end of the calendar year, or something like that.
Correct.
Just to make sure we're on that same page.
So Ed, again, that's, I think it was probably a good point raised by Supervisor McDonough. So one of the things would be, and the application process would have a deadline of, under this discussion, 1 year, something that may need to be added for future discussion on this. And I guess I would ask Ed Raber or Supervisor Wickham or Matt Speck, would we be ready to discuss this on Wednesday, or do we need a little more time? We're also talking about a review by County Attorney May. What would be the preferred?
Yeah, I'm comfortable with Wednesday. I mean, I think we've got, this program is active in place. We're just changing the geography of it. So, it's been successful, at least in the launch and the origination. The business owners seem to be pretty receptive of it and very appreciative of it in Dubuque, the city of Dubuque. So I think we should be ready by Wednesday, assuming we can get a review from the county attorney.
Okay. I'm not hearing objection to this, just, discussion. So this is, again, not action on it, but I think I'm hearing, as chair, I'm hearing consensus to move it to the next step, to have some modifications regarding the application, timing of the application, and maybe some input at the meeting on Wednesday from some of the experts in this field from Dubuque County outside the city of Dubuque.
Okay.
Fair statement? Okay. I think we have consensus to move forward and get this on Wednesday's agenda for possible action and further discussion.
Thank you.
Any other questions, comments on the Dubuque County Emergency Loan Fund proposal?
None from me.
Okay. If not, we'll move to agenda item D, MHDD fund balance report. And
Hi, it's Jody.
hi, Jody.
Hi. So the supervisors requested that Stella and MHDS provide them with a history of the regional fund balance project. And so we got together, meaning myself, Stella, and Jesselyn, and emailed back and forth and came up with the spreadsheet that is now on your screen. So that first row is by fiscal year, what was approved by the supervisors and then also by the regional governing board. It's by fiscal year. The second row is the amount that was approved in total project amounts by fiscal year. The third row, what was actually billed to the region by fiscal year for the approved projects by each provider, and that is that's as of April 28th, 2020. And the last row is what Dubuque County has actually reimbursed back to the region to those providers that built the region for the fund balance project. And that again was as of April 28th.
Jody Ann McDonough, I have a question for you. First, I appreciate very much that we made an attempt here and we put this onto paper, so thank you for that. The group of small group that's been working on some projects has been having some email about this, looking at how what position that this puts the county in for further fund balance projects. So this is a good piece of information to have. My question goes to whether or not any of these funds were rolled over one budget year into the next, or when I see, for instance, fiscal year 19, the $74,000, none of that was billed, correct?
That's correct.
And so that money did not move forward. That money is no longer in existence, right?
Well, it would have remained in the fund balance.
Hi, Ann. This is Stella. That amount did get rolled forward. That Access Center project was originally split between FY19 and FY20. And the total project was $125,524, which is what is budgeted in FY20. So that $74,612 was rolled forward into FY20.
So the $74,000 is included in the 261?
Yes.
So then as we come to the end of fiscal year 20, what numbers are going to roll over into 21?
Nothing at this point. Nothing automatically rolls forward. We brought those forward intentionally. There's nothing planned at this point other than the $180,000 that we put into the budget. Now, that's not to say that can't be amended at any point, but it is not intended to be carried forward indefinitely without project.
But I'm talking about rolling it forward in two budgets. the regional budget and the county budget. Jody, that's a question I think for you. So there's going to be a significant balance, it would seem, left from fiscal year 20 because of COVID in large part. Is that money going to be able to, do we get to use the remaining balance of the 260? Well, we have more than $200,000 likely. Will we get to move that forward and add that to the 180?
I believe there could be a process that it could be amended, as Stella just mentioned.
I've never been aware of an amended regional governing board.
Well, it's absorbed because what happens is it's not actually increasing the actual regional governing budget because it's because it's actually coming from the Dubuque County fund balance, not from the direct regional budget.
Yeah, and I think this is Supervisor Wickham. I mean, I think the key thing would be how long the regional body is going to allow these, quote, fund balances. I mean, we can create additional fund balance funding through our levy at any point. So it's these dollars that we're claiming are local Dubuque County dollars, all of the mental health dollars originate as local Dubuque County dollars, and then we send some to the regions. And historically, there's been this balance that just keeps transferring over the series of my 5 budgets. But every year, it's the reason that you have a balance is the actual levy that you impose. So it's kind of this made-up thing.
Well, and it would totally depend on existing fund balances and also the desire of the regional governing board. It seems, my opinion, that these are tapering off, meaning fund balance projects as other counties' fund balances diminish.
Right. Lynn County basically eliminated theirs because they're opening an access center. The same with Johnson County. They built up budgets, and now they've used millions. They've emptied those to move forward on access centers with significant fiscal improvements, one building and the other tremendous, renovation. So that's the reason some of these are tapering off. And what I see from the smaller communities, they continue to look for novel ways to deliver services to their citizens. And I think that's what we're doing as well, trying to be responsive and targeted with the fund balance dollars that have accumulated over time.
Yes, I would agree with that.
Okay, any other questions?
I guess I'd go back to my comment. It's not necessarily over time. We can increase this and decrease this at our directive. And that was the whole extensive conversation we had related to the mental health levy and the balances that we keep. Until you have a clear direction from the region or a clear direction from our local board that you want to move these forward, the dollar amounts and the balances, while they're interesting, don't really do anything for you.
I'm going to ask a question. I think it's more for public knowledge with this now being a public document. There's a reference to Deb Guard, budgeted to Deb Guard. It's a little unusual to see a specific individual referenced in a document, but I'm assuming that Deb Guard is the budget director for the region. Is that a fair?
Yes, Dave, thanks for asking that. She is the financial and analytical coordinator for the region.
Okay, so again, in a budget document, it's a little unusual to see a specific person named in there. That's why I wanted to ask the question.
Okay, thank you. I'll try to avoid that in the future.
a title would be sufficient just in case, the name changes down the road, through personnel change, marriage, whatever, that, people would know that that's, a position. So, thank you.
Okay, yep.
Okay, other questions on the, document? All right,
Chris Corkin was present on this meeting earlier. I don't know if Chris has a question. If she's still with us, this document would have related to something she's working on. I don't know if Chris is still here. I
do not see her on the meeting anymore.
Okay.
all right. We'll move, forward. On the agenda, item E is public hearing for CDBG Expanded Food Assistant Grant.
This is Ed Raber, and I'm here to address that.
Okay, thank you, Ed.
In today's, if Dawn could help me out, throw the that proof of publication up there. 5A, page 18. That may appear there. I'd start by saying, Chairperson Baker, that this shows the proof of publication for the public hearing you're having today, and I would ask for a motion to go into public hearing. There are some documents that if you'd like, I could go through some of the information I provided orally in the packet, and then go into the public hearing after that. If that's your pleasure, I'd be happy to start that way.
All right, let's do this. Let's go with a motion to approve the proof of publication in 5A.
So moved.
So moved. Second.
Okay, there's a motion made and seconded to approve the proof of publication. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. All right, now we'll go
I'll make a motion to open the public hearing.
Thank you.
Second.
Motion made and seconded to open the public hearing. Is there any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. We are in public hearing for the CDBG Expanded Food Assistance Grant. We'll go back to Ed Raber.
Thank you, Chairperson Baker. The information that you see on the screen here, and that was in the packet, is my explanation. Earlier this spring, this county made an application with the assistance of ECIA to acquire some emergency community development block grant. That's what CDBG stands for, Community Development Block Grant Funds. The purpose in the application was to provide additional food and meal resources to areas of Dubuque County outside the city of Dubuque. A few weeks ago, that application was awarded. It's something I noted in my memo there, that typically this is done, these public hearings that we're in now is usually held prior to the application being submitted, but because of the emergency nature of the initiative at the state, these were allowed to happen after the award has been made. And so that's what this represents. This is the public hearing on that application. The typical community development block grant requires some local match. I'd like to point out again that this one does not require any local match from Dubuque County, and Dubuque County has not offered to include directly with this project a local match, although the county has allocated some resources to address COVID-19. it's not necessarily specifically at this particular project and won't be included in the record keeping for it. So there are a number of items that are required by these federal dollars to be addressed in the public hearing, and I provided them in written format, and painful as this may be, I'd like to go over them orally too, just to make sure that they are covered in the minutes here. If that is okay, Chairman.
That's okay with me. Any questions or concerns from Supervisors Wickham or McDonough?
Nope.
Hearing none then, the federal guidelines ask that we identify the need for the Community Development Block Grant Program, the project that is. And I've written the Dubuque County Board of Supervisors determine the need for expanded meal and food distribution in the areas of outside the city of Dubuque County, outside of the city of Dubuque, because of several factors. Governor's statewide directive for people to stay at home and limit trips to stores, rapidly rising unemployment rate in Dubuque County, resulting in many more families whose income falls below the low and moderate income threshold, reports from organizations initially providing free meals or food boxes that food insecurity was significantly increasing in Dubuque County. That's not an exhaustive list. That is what we're providing to make sure that we have covered that. There may be other comments from people on this line that I'd like to get to at the end that may have some other feedback. Description of the Community Development Block Grant funded project and the activities. Project activities involve 8 local organizations and nonprofits collaborating to expand services to deliver meals and food to communities in Dubuque County outside the city of Dubuque. Listing of the individual CDBG project partners are listed as an addendum to this description, and I can get to those, along with the individual activities, time frame, and funding allocation. I'd like to actually go to that page, which is, I think, 2 pages from further down. This is a page, Dawn, that's on page, I'm not sure where it is in the packet. It's a horizontal page, page 22. Thank you. I'm not going to read this entire table, but the participating partners, as we're noting here, this was part of the revised application that the county submitted to the Iowa Economic Development Authority. That includes the Dubuque area labor harvest with $18,000 for expansion of services to the rest of Dubuque County. Project Rooted, $12,000 for expansion of services, an additional 200 to 300 meals a day in the county. St. Stephen's branch of River Bend Food Bank, $8,820 for expansion of services for the next 3 months. Northeast Iowa Area Agency on Aging, $9,912 for expansion services to Dubuque County door-to-door services for 300 to 400 meals daily. Northeast Iowa Agency on $1,000 for new services for partners with up to 5 restaurants in Dubuque County to provide hot meals to senior citizens, as well as an additional $1,400 for additional supplies like insulated food bags and gloves and hand sanitizer. Double Up Food Bucks program, $6,000. A SNAP program provides $10 for fresh veggies and fruits, matched with an additional $10 here for additional dollars for fruits and vegetables in the Cascade, Dyersville, and Piasta area that they would be expanding to. Dubuque County Health and EMS supplies, for those distributing the stuff, $8,000 to be used for N95 masks and hand sanitizers. And lastly, Region 8 Regional Transit Authority, the RTA, for new services, totaling the balance of the funds, about $10,000 to provide grocery delivery, meal delivery to participants out in the county. Total project is $99,282. I'd like to go back to where we were before on page 20 of the packet. As I said, for issue number 3, the amount of CDBG funds for the project is $99,282. All of the funds in the project are federal community development block grant funds. Issue number 4, the estimated amount of CDBG assistance that will benefit low and moderate income persons. Project will not require that persons receiving food delivery or meals provide income verification to receive benefits. However, persons receiving the food and meals will be presumed to be food insecure, as well as having low and moderate income household incomes, or that persons are temporarily under the low and moderate income threshold due to economic instability and household job loss. The location of the project activities is the benefit of the CDBG project will be for persons living in Dubuque County but outside the city of Dubuque. Some of the project activities, such as meal preparation or food storage for distribution, may occur in the city of Dubuque or elsewhere. However, the CDBG project will not serve persons living in the city of Dubuque. Issue number 6, any relocation that will have to take place as a result of the CDBG project, and there will be no relocation of persons as a result of this CDBG project. The county contact information for residents to contact with concerns or complaints regarding the project should be directed to myself, Ed Raber, Interim Board Executive Director, Dubuque County, 720 Central Avenue, Dubuque, Iowa, 52001. And my phone number is 563-587-4899. My email address is ed.raber@dubuquecounty.us. Next, community development and housing needs to low and moderate income persons in the county, and any planned or potential activities to address these needs. I'm stating here in my response that Dubuque County, outside the city of Dubuque, is served by the Eastern Iowa Regional Housing Authority to provide housing choice vouchers to persons with low and moderate income for rental assistance at scattered site housing as well as project-based housing. The Eastern Iowa Regional Housing Corporation Housing Trust Fund operates housing trust funds to assist in the provision of providing decent, safe, and affordable housing, as well as providing access to the resources for creating housing opportunities to the families served in Eastern Iowa. The emphasis is to provide economic assistance to benefit the moderate, very low, and extremely low income residents of Dubuque, Delaware, Jackson, Cedar, and Clinton counties for a variety of housing needs. And that is from the Housing Trust Fund's website. This is not an exhaustive list, but it is some of the things, especially that Dubuque County supervisors are engaged with. Lastly, other community development and housing needs and any planned or potential activities to address these needs. And I've listed 2 that are things that are going on out there. One is several Dubuque County communities have completed housing needs assessment with plans to address affordable and safe housing in their community. That includes the city of Dyersville and potentially some others. There is also the city of Piasta recently announced that they are beginning an initiative to have new multifamily dwellings built near Northeast Iowa Community College, primarily to provide affordable housing for college students as well as for the community. So that concludes the remarks that I had prepared. I'd like to also note that these particular CDBG funds do not come with any administrative dollars. I believe that the Iowa Economic Development Authority is assuming that these draws on these resources will not be very many, 1 or 2. And in my conversations with Dawn Sherman, we believe that we can manage those without an outside contract. That's the way that these were intended. And that is the purpose, the identified partners in this, and contact person for the CDBG grant. So if the board wants to recognize if there are any other people from the public that wish to make comments about that, I personally so far have not received any comments.
Okay, thank you, Ed. I will at this time ask if there's anyone who would like to speak in the public hearing in regard to this matter, and please do so by raising your hand on Zoom, as there are no one from the public here in the Board of Supervisors chambers. And we'll give a short amount of time here for folks to indicate whether or not they want to speak. Okay, at this point, no one has indicated that they wish to speak on this. So I would ask the Board of Supervisors for a motion to close the public hearing.
So moved.
And I will second that.
Okay, motion made and seconded to close the public hearing. All in favor signify by saying aye.
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 Aye. Carried 3-0 to close the public hearing. And
I have a question for Mr. Raver.
Yes.
How is this application was drafted and then redrafted by ECIA? How have they been compensated?
I don't know. That was actually before me. I don't know what arrangements the county had made with ECIA for the preparation of that. In my conversations with the CEO, Kelly Detmeyer, she has not indicated anything about that to me. So I do not know.
Is Dawn Sherman with us? I asked her to check into that for me.
Yes, I have not heard back from them if they are proposing to charge us a fee for that.
But you did extend that. Did you reach out to them, Dawn?
Oh, sorry, my mic was off. Yes, I did.
Okay. I just wanted to be sure we were fair with them because they were going through the ultimate hustle to get this done under extreme time concerns. And then the funding, we didn't realize there'd be no administrative fees in the grant until, of course, the final result came back.
We'll ask for something in a note or something like that from Kelly Detmeyer in writing to make sure that we understand that and we can document what their wishes are.
Thank you.
okay. I guess normally we would have some kind of a resolution, something. I don't see that, so.
Correct. You've already done all those things.
Okay.
So this is not an action item. It was just a public hearing.
All right.
The last follow-up, as Dawn and I have conferred on this last week, there are some additional items that Dawn decided not to further burden this meeting. The federal government, in the use of these funds, asked for this, its recipient, in this case that's Dubuque County, to adopt several different policies or reaffirm that. So I believe that Dawn is preparing that information for Wednesday's meeting.
That is correct.
So there will be some additional action items.
All right, thank you. Thanks for the report, Ed. Okay, any other questions on the public hearing for the CDBG Expanded Food Assistance Grant? If not, we'll move to agenda item F, emergency closing due to public health risk policy. We'll go to our Human Resources Director, Dawn Sherman.
Thank you, Mr. Chair. So previously, as the whole COVID crisis started and the county was looking to change operations, whether to reduce public access to buildings, and obviously workload changes have occurred in several departments, we developed a policy to address employee pay during this time. So the board had previously approved this pay policy through today. So I'm looking to seek some feedback and guidance if you would like to continue with these pay policies. I have proposed in here some changes to this based on feedback from elected officials, department heads, regarding some of the usage of the time. So the first one is in regards to how employees are utilizing what we call paid absence sick leave, or COVID sick is how it is in our pay system. Currently, any time an employee is absent from work because of a health condition, whether it is COVID related or not, they are not being required to access their sick leave banks to pay for this time. We're paying that. So if an employee is off because of a non-COVID related illness or injury, they do not have to utilize their sick time. Some of the feedback I have been receiving from the department heads and elected officials is that there is a possibility of employees abusing this pay privilege, that there is no negative consequence for them calling in sick because they're not having to utilize their sick leave banks that they have. And so I am proposing that we remove that provision, that we will pay the employee the COVID or paid absence sick only in the event that they are absent due to that particular condition. So if they're out because they have a toothache or they sprained their ankle, they would be going back to utilizing their sick leave banks, which all have very generous sick leave policy in place for all of the employees in the unions, and also our admin policy. Just as a note, I do have all of the elected officials and department heads who are on, I believe, available to be able to unmute yourself if the chair would like them to comment on this particular proposal.
I'd certainly like to give them the opportunity. So if there's any of our elected officials or department heads that would like to speak on this, Dawn, did you want to go through, there's just a little bit more that's changed. Do you want to cover that and then we'll open it up?
Yes, I can do that as well. So the other part, a substantial change would be in the event that the employee is unable to secure childcare. So what I am proposing here is consistent with what we are required by the federal government to provide in this particular instance. Currently, if an employee just identifies that they're unable to find childcare for their dependent children, we have been releasing them from work and then paying them, in essence, just regular pay. They again are not required to utilize any of their vacation or personal time. What the federal government has required is that we allow up to 12 weeks of paid leave, which again would not access their vacation or personal days or their banks, but it would be done at 2/3 of their regular wages. And again, that's the minimum that we are required to do by the new federal regulations concerning specifically COVID here. So the language here is based off of that federal law. So an employee who is able to, they would have to apply to do this because it's under a family and medical leave expansion of what most people know as FMLA. They would have to provide documentation of their bona fide need to have that leave. And if eligible, then we would pay them at 2/3 of their hourly regular rate of pay. So those are the two changes that I am proposing. Need some guidance from you if you would like to implement these changes. Again, you have previously voted to continue these pay practices through today. So we would also need to have discussion about, and guidance about how long you would like to continue these pay practices.
I did have a question. I think it was explained, but this provision under the child care for dependent children, is that in addition to FMLA leave?
That is correct.
Okay. All right. Questions, comments from Board of Supervisor members or any of our department heads or elected officials, including Mr. Raber.
Thank you. I don't have any other comments besides what Dawn has presented.
Okay.
Hey, this is Joe. I have a question.
Go ahead.
So just so I'm reading this correctly, so we have two people off because of childcare things. So then effective, I don't know if tomorrow or whatever you guys put this in effect, if it changes, those people will then continue to be able to be paid to stay home, but at 2/3 the rate. Is that what you're saying on this?
That is correct. They would have to fill out, we do have the federal, the Department of Labor has provided paperwork so that they would have to go through an application as they would for, as if they were requesting any other FMLA leave. And so they do have certain number of days, I believe it's 15 to complete that. And if they are approved, then we would retro it back to the day that they requested it, and they would receive pay at 2/3 of their regular rate. Correct.
Okay, thank you.
Dawn,
I do want to clarify, since this is Sheriff Kennedy, because we have discussed this. So the regulations that have come down from the Department of Labor have excluded what they consider emergency responders. So we do not have to provide this benefit to what they consider emergency responder. And in that definition of emergency responder, that would cover correctional officers for the jail operations and also our Sunnycrest operations. Their staff, we would not have to make this type of leave available to them.
Dawn, I want to follow up on Sheriff Kennedy's question. If somebody is off currently, they would be getting their full pay. Let's assume that's 40 hours a week or 80 hours in a pay period. This change then would change that to 2/3 of that, and that's what the federal guideline, the minimum federal guidelines are.
That is correct.
Okay. So would they have to reapply, or would it simply be a change in their compensation?
We would have them apply for that. Currently, we're not asking for any documentation. So going forward, I would recommend that we do have that documentation on hand.
All right, thank you. Other questions from department heads, elected officials? Okay. And anyone have their hand raised? I think you have them all muted. So, all right. Back to the Board of Supervisors. Then this is a document that's been presented. It's on the agenda properly. So, what's your pleasure on the emergency closing due to public health risk policy? And Dawn, do you have a recommended timeline?
I guess I just want to make one thing clear. If you make no changes, if you do not accept or vote to implement the changes on here, but keep it as the current policy, I just want to note that we'd still be meeting all of the Department of Labor guidelines, because what the pay practice that we currently have in place is more generous than what we are minimally required. So even if there's no change to the policy, I just want to make sure everyone understands that we are providing more than what we are required to, and so we would not be in any violation there.
Okay, so.
This is Ann.
Mm-hmm. Yes.
The question: if we have an employee who is unable to secure child care for dependent children, are they still expected to work from home?
Under this, if they filed under, currently, we're releasing them from work. If we go with the proposal here, we would not be able to require them from work from home.
So how many employees do we have who are exercising this, who we are paying because they cannot find childcare?
That would have to be, we don't capture that in here. The pay code that we have under this is if the employee is not working at all because of childcare. There are some individuals, employees that are working remotely because of that, but they are still putting in their regular hours. They're just doing that remotely. So I don't have that number. We're not capturing that. That would be done with the approval of the individual elected officials and department heads.
Has anybody seen this before today? So if I were an employee who was unable to find child care for my dependent child, and now my pay is being cut by a third, isn't that also the proper reading of this?
That is correct.
And so what input have we given to people? I mean, wouldn't that be grounds for them to say that's a material change in circumstances and it's an involuntary quit? Do we have a union issue?
Okay, so this was just included in the packet. In regards to a voluntary quit,
I'm saying my pay, let's say that I am that employee who is unable to secure child care for dependent children. In the past, I've been paid at my full wage, correct?
That is correct.
Now this is changing that to reduce my pay by 1/3.
That is correct.
And then that would be, in my experience, a material change in employment, and it would be considered that someone could say that's a termination. It's a material change, going from full salary to 2/3 salary, or wages, or whatever term you want to use. But we don't know how many people this is, but in theory, we've cut some folks' wages by a full third.
Let me ask another question, and that might be relevant. Under this, Dawn, would somebody be able to use their regular FMLA for the other 1/3 of?
Oh, so we're talking with pay. There are some, the Department of Labor does not prevent an individual organization for allowing employees to supplement this 1/3 pay with a vacation. I have not proposed that, but we could put that in here. So if they are receiving 2/3 of their pay, they could use some vacation to supplement that so that they would get a full paycheck each one. There is no limit of an organization allowing employees to do that.
And this proposal was made after discussion with department heads and elected officials.
This was included in the packet, yes. And yes, I've had many conversations. I don't want to speak for Chris Kirsch, and I think she has left the meeting, but she has expressed that in a previous board meeting that she had some concerns of potential abuse, specifically for the sick leave. I don't remember her addressing that with the dependent care.
Right, and in the sick leave, I'm following that. And when we drafted this policy, we knew that we were going to have to make tweaks, and that changes would possibly be necessary. But I think that this could strike an employee or two or a half dozen or as many as something that they might not be prepared for, that they're going to potentially have a full third of their wages cut. Now, obviously, they may not have child care expenses and so forth, but have we thought this through? I think it might be important to at least look at who this impacts, what's, in HR, you don't need to bring it to this level with specifics, but what's going to be the impact on folks when we do this?
So currently we had, in the last pay period, we had 5 employees who utilized this pay code. 2 of them, it was for their entire work schedule. So what that is that they are not working, they're not coming in to do like an A or B shift in some of our departments. They are not working remotely. They have identified that they are unable to secure childcare, and they have used this pay code. So there's been a couple of other ones that have been a day or two, in which they have identified that they would be unavailable for work, and so that they would be paid this. Nothing in this policy restricts individual departments for determining how the employee is working, whether it be remotely or if they're requiring them to come into work as well.
So this wouldn't apply to someone who is working remotely from home due to not being able to get child care, but they are working. This wouldn't apply to them. They would still get their regular pay.
Yes, because they're working.
Right.
These are the individuals who are receiving this pay code are unavailable to work at all.
Right.
And again, I don't know the number of the people working remotely due specifically to childcare. I mean, there are other reasons that we have them working remotely to promote social distancing, and for the safety is another reason why we have them working from home. So there's no pay code to identify which reason they're working from home.
And this satisfies
But
the
Supervisor Wickham.
Go ahead, Supervisor Wickham.
So hypothetically, this could be a CNA that can't work from home, obviously, because of that job. It could be somebody who's responsible for a deputy in the jail, and obviously you can't do that job, from home using Zoom or other methods. And so that would be a scenario.
Yes, it would. So for those 2 instances that you give, we are not required to offer this leave to the essential workers. But yes, you are correct that there's a reason that they would not be able to perform their work remotely, and they are unable to secure care for their children.
So the change in pay, maybe you can give commentary to the discussions you heard amongst the elected officials and the department heads. The change in pay is a fairness component or motivation to get them to come to work?
I would say both is the feedback I have received, and a deterrent not to continue to, to promote that they're looking for alternative forms of childcare. I would not say that this benefit has been abused by any stretch of the imagination. There has been, like I said, very few employees who are doing it. I think the feedback I have received is the worry that this could potentially be abused. But I'm not seeing that currently.
And that's on the child care side of it.
Correct.
So what was the strong motivation to change the language then?
To deter.
And maybe not strong, but the reason to change the language.
I want to use my words correctly here. So it is proposed so that, if there are employees that are essential employees that we have work for them to do, that it encourages them to look for alternative forms of childcare, so that they would be able to work for us and have work assigned to them.
I just don't like this. I think the fairness thing, if it was a fairness thing, I can think of some examples that have unintended consequences that could be pretty extreme. There doesn't say anything in here. Maybe I'm not reading the full I mean, do we have any kind of leeway for the department head to use discretion? You could have a situation where you don't have childcare because the childcare provider might have been a family member who can no longer be around little kids who are carriers. And then what? So I don't want to see anybody's children be placed in risky positions or makes the employee uncomfortable. I don't want to force something. I mean, we've been generous all the way through, and I don't want to make a change that has an impact on an employee just because it seems unfair. I guess I would, lots of this seem unfair, quite honestly, to maybe the community at large. At some point, we're going to go from being kind and generous to just looking like people are being able to work from home and they're not working full time, But have we looked into this to really see what are we trying to alleviate? What is that special circumstances, and is there another way to get at it?
And this is Joe. Just in response to that, I think everybody needs to keep in mind that regardless of what happened with COVID, that school was due to be out for the summer in a month, and everyone should have had some sort of a plan in place for what they were going to do with their children for daycare at that time. And now that a lot of these people have been off work for nearly 2 months, I think most of the daycares are, other than, I can't speak for the at-home daycares, but most of the large daycares are still up and running. And I think there are plenty of options out there. I mean, let's face it, there's 5,000 high school kids who are not in school right now, and could probably use some extra money. So, I mean, there's plenty of options out there if people choose to go that route. I mean, those are just my thoughts, but a few things that we need to keep in mind, because like you said, I mean, at some point, the generosity, we have to be generous, but also we have to be responsible for, the taxpayers' money that we're spending for people to not be at work.
I really think this is Dave Baker. We have two different issues here. If you look at the document, the first is employee. The first bullet point: employee is diagnosed with an illness, and what's been added in is associated with the public health risk. And I had a specific discussion with the department head about employees who said they had, I'll just use a hypothetical, a scratchy throat. Okay, you're off work for a period of time. Please go get tested for the COVID-19 virus. And they refused. So I think that's why we had to add in, or it suggested that we add in, associated with the public health risk. Because the concern was, we're not sure that they were ill because of being associated with the public health risk. So there was a concern, and I think it's a valid concern. So this fills in that gap. So that was the first change. The second change has to do with the child care, with the securing child care. And what we've done is moved from a very generous policy for the past almost 2 months to what the federal guidelines are requiring. Don, if that was an accurate summary, you can either agree or disagree. So that's the two issues that we're dealing with.
And again, there's nothing that prevents you from offering a more generous benefit as you have been. And I would ask that, if we look at this, to take these two, we can also take these two changes individually and not make it as a whole policy. And we also would need to know how long you would like to continue this to. My recommendation would be at least through May 15th because you had previously voted to limit public access to buildings through that date. And so again, that's where we have that reduced schedule leave. So at minimum, I would request that we keep this pay practice effective through then.
Okay. And there was a comment, question. Do we know if our insurance covers the testing that we were asking people to get? I don't know the answer to that.
I believe the insurance is required to, but I'll double check with Cunningham.
Okay.
I think the testing is required and covered, but it doesn't mean that it's not still expensive. So, but I guess I don't have an issue with the sick leave. I think that that's an improvement that needs to be made. But I do have issues still with childcare. I'd like to see there be something where there's a process by which an employee can talk to their department head, or Dawn, you can do more investigation and bring this back to see how we might be able to, we're not so big that we can't work with individuals on what's the extenuating circumstance. I agree with Joe, summer's coming up, but that doesn't make a difference if your daycare provider was a grandma who now can no longer provide that daycare because she's not necessarily supposed to be around kids because they're carriers. I mean, that's certainly in my circle in the world.
Well, I would suggest let's address the first bullet point. Is there a motion to approve the change in the sick or illness part of this? It reads, employee is diagnosed with an illness, and then added in is associated with the public health risk. Employee will be placed on paid absence - sick. That's added in, the word sick, until fully released from his or her personal physician. Is there a motion on that change?
I would make a motion to approve the language relative to the changes with regard to illness and sick.
Okay. Is there a
I'll second that.
All right, motion made and seconded.
I'll second it.
Thank you. Motion made and seconded. Any further discussion? All in favor signify by saying aye.
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 Carried 3-0. Now we'll move down to, there is another change, and I'd ask Dawn to briefly explain. It's in the fourth bullet point right at the end. It's, the sentence is, employee will be placed on paid absence - sick is added in until the end of the declared emergency.
Yep, I just added that, and you can see it in the other bullet points too. I just wanted to clarify how when we see pay reports that it's going to be paid as, and currently in our pay system it's COVID sick. So it's just kind of cleaning it up as we develop the pay codes. So there's no substantial change. It would not affect the benefit. It was just trying to make it more consistent with how we're seeing them in our payroll system.
Okay, so you heard Dawn's explanation. Is there a motion on the fourth bullet point, adding the word sick? I will make the motion to add the word sick after the word absence with a hyphen as suggested by Human Resource Director Dawn Sherman.
So if you look at it, it's actually in each one of those bullets, I believe. Yes, the first four.
Oh, I did miss it. Okay. It's in bullet points 2, 3, and 4.
Wouldn't that have been covered by the previous motion?
Well, I'll have to ask Dawn if that, If that's the case, then we don't need to take.
I would take it separately. Again, this is just clarifying how we're seeing it in our pay code system. It's not changing anything to the policy, or to the practice of how we're implementing the policy.
All right, so I'll restate.
Okay,
go ahead, Ann.
Make a motion to approve the payroll classification of absence-sick for purposes of monitoring payroll payments for COVID-19.
Okay, and Dawn agrees that that's a good motion. So, is there a second?
Yeah, I will second that.
Okay. All right. Any more discussion? All in favor signify by saying aye.
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 Carried 3-0. Okay, now we get to the fifth bullet point, and that would be the employee is unable to secure child care for dependent children. Employee will be, and then there's the changes. So stricken is placed on paid absence until the end of the declared emergency. And then added in is eligible for up to 12 weeks of paid expanded family and medical leave at 2/3 the employee's regular rate of pay. When an employee is unable to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable for reasons related to the public health risk.
So if there's no motion to approve this change, we would just continue on with our current pay practice. And again, I just want to state that would meet the minimum requirements by the Department of Labor.
Okay. And
Dawn, was there any discussion with the department heads on addressing essential workers and carving them out or making exceptions in this policy? Was that discussed?
I discussed, well, in the Sheriff's Department, we have implemented that they're not, they do, because in the previous portions of this policy, it states that the department head determines the essential workers and that they may not be eligible for all of the, I need to look at the word, all of the pay, COVID leave or public health benefit, pay and benefits in there. So we have implemented this with the sheriff. We had an incident last week, and we did not offer this leave because we're not required to.
Okay, thank you.
Now I had a question, Don. It starts out, employee is unable to secure child care for dependent children. Okay, but so it says unable. All right, and then in our added language, it references when an employee is unable to work due to a bona fide need for leave to care for a child whose school or child care provider is closed or unavailable. So to me, the first sentence would be, is there child care available in the community, in the area? This one is more specific, it sounds like to me. In other words, if I've been using XYZ daycare, if they aren't open or don't have room. So I think that could be read more than one way. There's kind of a general, because if you read the first sentence, a department head or elected official could call around and ask if they had openings for certain age individuals, and then that would make them not eligible. That's what I would argue if I was involved in this, which I guess I am now. So it appears to be contradictory.
My reading of this is that the broad initial sentence is sufficient, the manager, the supervisor is going to need to know and determine at some point whether or not someone is unable to secure childcare. And I think that that's going to be on a case-by-case basis, as it should be. And Dawn, I would expect you to be contacted to know the nuances and help identify the probably 2 cases that exist before us that are causing people difficulty. I think anytime we try to make some kind of change, you can have unintended consequences because we're not knowing, the size of the group, the particulars, and I don't want to know that. I don't want to know the particulars. That's why we have experienced professional human resources department. I'm not going to I'm not going to support a change to that.
The substantial change in this is the 2/3 pay.
That is correct.
Right, it cuts out a third of someone's pay.
A third of someone's pay.
I'm okay with maybe to get consensus. I'm okay with not making any changes as well in this area, and maybe we can focus on the date of how long we want this to be valid. If we wanted to do it to May 15th, and kind of move forward to that. But I also will not support a change at this point.
Okay, well so we'll go to, move from this, we do not have consensus on, apparently, and so let's, do we have a date on this that is being suggested? We do have the effective date of May 4th, which is today. Do you have a suggested date?
Yeah, my recommendation was at minimum through May 15th, because we are, many of these pay benefits are because of limiting access to public buildings and encouraging social distancing for those who are coming into work. So that would be my recommendation at minimum, that we expand it through May 15th.
Okay.
I'll make a motion to expand the document till May 15th as recommended by Dawn Sherman.
Second.
Okay, motion made and seconded to expand this to May 15th, 2020. Any further discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0.
Thank you.
Is that it for that topic?
That is for me.
Thank you. All right, next up, we have under item G, personnel requisition. And it would be a permanent part-time corrections officer, and we have been trying to keep the essential employees vacancies filled. And so Dawn, you have this was due to a resignation.
That is correct. And again, we're bringing forward only the ones for our essential, to replace essential workers on your off meeting days or your regular days. So for this one, for G and H, they are both in association with hires at the jail facility for the sheriff. So I'd recommend approval for both of them to allow him to continue his operations and filling vacancies as they come up.
Okay, let's deal with
Make a motion to approve the personnel requisition.
Thank you. Is there a second?
I will second that.
Okay, motion made and seconded to approve the personnel requisition in G. All in favor signify by saying aye.
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 Carried 3-0. Item H, resolution regarding appointment of deputies, assistants, and clerks. And this is the permanent part-time corrections officer in the sheriff's department.
Motion to approve.
And I will second that.
Motion made and seconded to approve the resolution. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. All right, that is the extent of the agenda for today. We are scheduled to convene at 10 a.m. on Wednesday. It sounds like Patrice Lambert may not be able to make it, but I think there's enough other items, and I think the Board of Health has probably some follow-up issues, so I would suggest that it be a joint meeting of the Board of Supervisors and Board of Health at 10 a.m. on Wednesday. Unless there's any objection or discussion to do something to the contrary. All right.
No, I'm fine with that.
All right, thank you. All right, we will need a motion to recess until 10 a.m. Wednesday.
So moved.
Second.
Okay, motion made and seconded to recess till 10 a.m. Wednesday. All in favor signify by saying aye.
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 Carried 3-0. We're in recess. Thank you all.